Good afternoon, everyone. It's Saturday, November 22nd, 2025, 1 p.m. Central Standard Time here in Champaign, Illinois. You're watching Co-op for Two. You're joining me for a playthrough of Medical Mysteries Miami Flatline. Last week we played the tutorial and the first case. No. What did we do? There's 4 cases in this game. We played the first 2. Yes, we played the first 2 over 2 days, Saturday and Sunday. And it looks like in the box there's 2 more cases, but they're combined. They're like patients 3 and 4 are part of the same thing, played at the same time, but an especially long experience. And I suspect what we'll do now is we'll play both of them together, patients 3 and 4. We'll play halfway today and then continue tomorrow. That's my plan. That's our plan here. Some of you who join me on Sundays regularly may be wondering what has gone on with Dear Holmes. Why are we not reading the solution letter to the case that we played in October, mostly? And the answer to that is that I'm still waiting for the solution letter from the Dear Holmes company. I expected that several weeks ago, but it still has not arrived. As soon as that comes, we'll do a little recap and we'll resume our Dear Holmes games on Sundays. I really hope that's before next week. Before we get started, though, let's see how everyone's doing. Wish everyone a happy Thanksgiving. I know not all of the world celebrates Thanksgiving. Here in the United States, it tends to be celebrated by having a big dinner with family or friends. I am getting together with some friends here locally. Let's see what everyone else is doing. We've got 13 viewers and 1 like. Melissa says, will there be a Thanksgiving stream? I'm off, would love to see one. I like the idea of having these streams during the holidays, but I am going to be having dinner with friends. It's possible we'll do a late night stream, but I don't want to commit to it. So if so, it will be on very short notice. Reese is getting cavity filled on Tuesday. Well, that just means you'll have a better Thursday for Thanksgiving. All right, let me get set up here while you guys are chatting. So if you haven't joined me for the playthrough of the first two patients, it's not required to play this one. These are totally independent. But these are rated as expert. Last week we had a hard, difficult patient. But this one's going to be even harder. We did get a good score on our first two patients, but we always have to be on the top of our toes here because it's easy to make a mistake and have a patient get injured. And the other thing that we tend to be slack on is the legal stuff. Let's remember to do better this time. Okay, let's take a look at patient 3 and see how this combined patient system works. Please note this patient is played in combination with patient 4, John Doe, as the two patients arrive at the emergency room simultaneously. This doubles the game's duration compared to a one-patient game. Again, I suspect that we're going to want to split this into 2 sessions today and tomorrow. Tomorrow at 1 p.m., just like today. Okay, your next patient is Senator Carmen Perez. She's a busy woman in the middle of her re-election campaign and thinks there's something wrong with her heart. The hospital's very short-handed today, and she has very little patience. Quickly open this envelope, check the contents, leave the epilogue sheet in the envelope. You will also need the result codes booklet and the 4 research sheets from the codes research rules envelope. Okay, no discussion here of opening patient 4, so I'll just keep that to the side. Let's open our, let's get our rules reference stuff. We'll keep this diagram handy. You remember these, I'm sure. Boy, the stream is a little choppy here. So there's that. The rules I don't think we're going to need. And there's our result codes booklet that we look up stuff. So let's go ahead and open this. What does this say? Before you play, make sure all the game parts are included. Okay, so we just don't want the epilogue. So we've got her intake sheet. There's the epilogue. There's her card stack. And there's her intake interview. Okay. Let's start with our interview here. Senator Carmen Perez, age 57, female. You were due to end your shift, but the hospital's extremely short-handed today. The emergency room is packed with incoming patients, and the director has asked you to stay for another shift. Going to be a long day. To top it off, one of your patients is Florida Senator Carmen Perez, and she is not pleased. Do you know how long I've been waiting to see someone? She says. I could have died. Isn't this an emergency room? You apologize and explain how busy it is. You ask why she's here. I'm finally taking a day off from campaigning, and all of a sudden I'm feeling chest pain and I'm having trouble breathing. My husband is off in Texas on a building project, so I drove myself here. I'd like you to check my heart. Nurse Judy steps into the room. I'm sorry for interrupting, she says, but you're needed immediately in room 202 to assess a potentially life-threatening situation. My situation is life-threatening as well, says Senator Perez. As you get up to follow Nurse Judy, the senator says, Where are you going? I was here first. There isn't time to argue, says Nurse Judy in a low voice intended just for you. It's a potential drug overdose. Senator Perez stands, obviously overhearing this, and says, You've got to be kidding me. You're going to prioritize a drug addict over a civil servant who might be having a heart attack? Nurse Judy nods to you to leave while she steps in between the two of you. Senator Perez, she says as she grabs a clipboard, let me take down the details of your condition. You rush to see what's happening in room 202 as Senator Perez says, this is unbelievable. You people are giving me the worst headache of my life. Take status card SC1, racing heart. Okay. So it looks like we are going to have totally unrelated patients. It's just that we're going to have to manage the time pressures of both of them at the same time. That's how I interpret it. Which is an interesting challenge. Like all of our decisions under time pressure about what to do when are now complicated by the fact that we've got two patients. So here's her status card. She's got a racing heart and all the things we can do. And then it says take the senator's update before John. Okay. So she's got a racing heart. What does she say? Chest pains, not racing heart. She says, I have chest pains, trouble breathing. And then this little subtle comment about having a headache. All right. We're going to now take our next patient, but it also says extra instructions. For this shift, you'll be treating two patients at the same time. 5 actions every 2 hours. Why 5 actions? Shouldn't it be 6? We normally have 3. Shouldn't we be getting double? I guess we have to, there's time taken to move between them. Each time you choose an action, decide which patient you're treating. Choose an action from that patient's status card, then write it on your patient form. The actions for both patients go on the same patient form. Huh. Important, when it's time for an update, remember to read the update for both patients. Start with the update for Carmen Perez, then read the update for the other patient. All right, I can see how this is going to tax our cognitive load here. So here's Carmen Perez. Okay, but before we look at her chart, we've been called away to deal with patient 4. Wow, look at this big patient form now. This is different from what we've seen previously. All right, so we've got 2 patients now to worry about. Guess we're gonna have to organize our stuff well. Maybe we'll put our first patient over here. And here's our second patient. And we've got this big form. Instead of 3 time periods per thing, we've got 5. But we're combining both patients' activity at the same time. Okay, let's read his intake form. His intake interview. We've got John Doe, an unknown age male. First, we want to review the EMR of patient 3. So they want us to look at this first. Okay, let's go ahead and follow the instructions. What have we got? Senator Carmen Perez, 57-year-old female, politician. She's got a headache and chest pain. Here are her stats. Temperature normal, heart rate normal, but her blood pressure is elevated, sort of in the middle, yellow. And her lung breathing rate is elevated. No recent illness. Yes, she's been traveling recently. She is allergic to iodine. Iodine would be used in a ink when they give you iodine to trace your blood when they do certain scans. she's taking a whole bunch of medications that we'll want to look up. Fluticasone. I don't know any of these, but maybe they are heart medications. We'll find out. Okay, her blood type's B positive. She's got a GERD medical history. I think that might be acid reflux. We'll have to check it out. Seasonal allergic rhinitis. Autosomal dominant polycystic kidney disease, and ADHD. So she might be taking like speed or whatever they give the kids for ADHD. Okay, her mother had high blood pressure. Her father, unknown. Social history. She's married, lives a husband, has 2 adult children, works as a senator. Alcohol, she never drinks. Tobacco, she smoked for 2 years, but not since then. But she's taking lots of medications and has high blood pressure and kidney disease and ADHD, which she would be taking drugs for. Amphetamines. All right, let's take a look at her entrance exam. Although maybe we shouldn't. We're kind of in a rush for this other kid. So we've taken a look at this. Nothing screams out emergency at the moment. So let's move on to our kid. We'll read these intakes and then we'll talk for a minute. All right. Patient in room 202 is alert but seems lost in his own world as he reaches out into the air with his finger to touch nothing. He looks to be about 19. His nose is runny, his forehead is damp with sweat, and he shakes his leg frantically, all typical symptoms of someone experiencing withdrawal after taking Narcan. So Narcan would be for an opioid overdose. The ambulance driver catches you up on what has happened so far. We received an anonymous call about a drug overdose. The caller said they had given him Narcan from a nasal spray, but hung up before the 911 dispatcher could ask how much had been given or what drugs he had taken. When we arrived at the location, we found this kid alone in the street, vomiting up his guts. He's clearly aware of what's happening around him, but he's uncooperative and wouldn't answer my questions, except to say someone beat him up and stole his wallet. What's your name, you ask? No answer. You wave a hand in front of him. His eyes follow your hand briefly, but he ignores you. You can see a laceration on his head, and he seems to be favoring his right arm, rubbing just below the wrist with his other hand. You reach out to touch him, and he knocks your hand away. He flinches at the movement, then puts his hand on his back as he winces. When was the last time you had something to drink, you ask? At that moment, you hear a phone ring. The young man reaches into a pocket, pulls out a phone with a cracked screen. It's an incoming call. He sends the call immediately to message. Why'd you do that? The ambulance driver asks. He doesn't answer. You suspect that even if you took his phone from him, it would still be passcode locked. No clues to his identity there. The young man shivers, and he looks like he might be ready to throw up again. The ambulance driver says, I've got to head out. Busy day, as you know. Good luck with your John Doe. You'll definitely need that good luck. How do you help someone who clearly doesn't want to be helped? Take status card SC6 overdosed. Decide which patient you're going to treat first, then choose an action from their status card and write it down. All right, let's get his status card, and then we'll talk about this. Well, we'll look at his form. Status card 6, overdosed. It's kind of odd that we're not starting with status card 1. All right, there's his status card. Now, what's the chance that these two are related? Seems unlikely. What's her family history? married, has 2 adult children. This kid I wouldn't classify as an adult. He looks about 19. I guess he could be younger, but probably totally unrelated cases, right? All right, let's talk about this. Any thoughts? Remember that when you say something, you better make sure, if you make a recommendation or talk about one of our patients, you better make sure you say what patient you're talking about, because by the time I see your comment, I might have moved on to a different topic. Could be 30 seconds ago, so I won't be able to get the context of what you're saying. Okay, we should look up her medications. Not sure why it says that respiratory rate of 20 is high. Debbie thinks maybe a drug deal gone bad for our kid. Okay, let's read the admin exams for our patients here. So here's our senator. She's alert oriented. She has a headache and chest pain. Blood pressure is high. Other vitals are normal. She is agitated. Respiratory, clear to auscultation. So they listened with a stethoscope, and her lungs sound okay. Her movements look fine. Her eyes aren't yellow. Her nostrils, it doesn't say. Patent nares. I don't know what that means. No cervical lymphadenopathy. No swollen lymph nodes. These are the things I guess they check quickly when they're bringing you in. Your lymph nodes aren't swollen, so you don't have like a flu or something. Her muscles seem fine. All her strength is normal. Cardiovascular, regular rate and rhythm, no murmur, but she has high blood pressure. Heart rate is normal, but blood pressure is elevated. You could get that just from being angry. Okay, no joint pain, no tenderness in her abdomen, no swelling in her extremities, skin looks fine, gastrointestinal, no abdominal pain, vomiting, or diarrhea. Now, here's a little summary of her medications. Fluticasone, propionate, 2 sprays in each nostril once a day. With dexamethasone, that's going to be some amphetamine for her ADHD, surely. 30 milligram capsules, 2 capsules orally every morning. Omeprazole, 20 milligram capsules, 1 capsule orally every morning before eating. I think that might be for her reflux. We'll look it up. Tolvaptan, 45 milligram tablet, 1 tablet orally daily. Her last medical visit was 6 months ago. She had high blood pressure. She has white coat hypertension. That just means she gets anxious around doctors. Will make at-home blood pressure checks and follow-up in 2 weeks. No follow-up visit noted. In other words, 6 months ago, she came in for high blood pressure, and she hates going to the doctor. So she said, look, I'll take my blood pressure at home for a couple of weeks, and I'll come back in. And she never came back in. Okay, we're going to look up her medications in a minute, but let's first take a look at our kid here, what his admittance exam looks like. Alert, disoriented, non-cooperative, does not answer questions. He's disheveled, he's underweight, pain all over. Appears to have been roughed up, bruises, but no obvious broken bones. Moody, non-cooperative, normal. No shortness of breath or cough. Lungs are clear. His eyes are fine. No lymph nodes, non-cooperative, regular heart rate and rhythm, no murmur. So he looks like he has back pain, but he won't say anything about it. Bowel sounds in all 4 quadrants. That's a weird thing to say. Maybe you're looking for blockages. Bleeding, facial laceration, right arm is wounded. The call came in, said he had an overdose, and they gave him Narcan. So he had an opioid overdose. They gave him Narcan so he wouldn't die of the overdose. And there is a little bit of a rebound when that happens, which we're going to read. Okay, and then we don't know anything about his history. Okay, so that's our 2 patients. We're going to try to keep them separate. I feel like, I'm trying to think what, I feel like we did this in an order. I'm going to move our John Doe over to the left, just because somehow the order, I guess maybe because we played last time with our patient over here on the right. So I'm going to put our primary patient here, and I'll put our John Doe over here. See where you can see it. It's going to be important that we keep everything organized so we don't lose track of stuff. All right, so before we get started reading about our drugs and stuff, I did want to have a little quick talk about the nature of this game. So one thing, this game is designed very deftly, and as we've seen, there's a bunch of times when we should have followed up with some legal issue and we haven't, and we got penalized. But one thing that I think we might consider, we've often talked about here about like the medical costs not being a concern in this game, which is a little odd, but an interesting thing for us to think about is how much we want to sort of role play this as if you were a real doctor with politics involved. So consider, we've got a politician coming in. A doctor might say everyone's life is equally valuable. But in reality, we have to know that if we prioritize this drug addict who might be a drug dealer, and our senator has a major heart attack and stroke, we're going to be in a lot of trouble. Like the political ramifications for our politician having something go wrong, we're on our 2nd shift, we're tired, like the political ramifications for us, for our personal job, and for this hospital are very high. And in reality, the doctors might say everyone is equally important to me. But in reality, a real doctor would be prioritizing this senator much more highly than this kid. And I do think we might want to consider that when we're thinking about worst case scenarios, we might want to worry more about the senator, something going wrong with the senator. I'll also say this. I mean, that's a sort of political question. From an ethical standpoint, if this kid is doing fentanyl or whatever and had an overdose, I mean, ethically, I'm a little more inclined to be like, well, there are some costs and risks to doing that. And if I had to trade off treating 2 people, one a drug addict who's overdosing and someone who's trying to live a good life, I would prioritize the live a good life. On the other hand, this is a politician. I wouldn't really classify them as being the... You could argue that a politician is of less ethical, moral value than someone else. So, job concerns, politics, moral ethics. All right, now let's see the chats. We've got the people joining me for these games take these very seriously. So Debbie says, I get the point about political consequences, but we have to triage. Surely, triage is a great word if you don't know it. It's about deciding what's most important and making hard choices about limited resources. Melissa says, you're not allowed to do that. You classify the people with the biggest emergency. It doesn't matter who they are or who they think they are. Yeah, that's the official line. Nelson says, we need to be professionals. Let the nurse take care of the hospital image by keeping her busy. Yeah. This kind of thing is why doctors are not allowed to make moral judgment. You're giving me like the official line, but I don't buy it. I don't believe it. I don't believe it. I think doctors are human like everyone else, and they make some political, moral judgments. All right, we read our intake interviews. You could see how the best, most accurate way to play this game is to sort of put yourself under real-time pressure and have a real clock ticking by. But we don't play that way. The game doesn't want you to play that way either, or at least it doesn't recommend it. I'm surprised there isn't like a variant rule in this box about like, hey, if you want to play with real-time pressure, give yourself 10 minutes per decision. But we don't play that way. So we're going to take our time and look up our medications here, but the chat is still on me about this. The medical professionals in the chat are still upset. That isn't the professional line. That is what you do. By saying that is the professional line, that's degrading medical professionals. I'm sorry. Okay, Melissa is saying that I'm not being fair to the medical professionals. Debbie says, imagine you overheard the doctors. I'm not saying this is something that people would say out loud. I'm just saying that all professionals, there's nothing special about medical professionals. I'm just saying all professionals, legal, police, medical, all professions that deal with people's lives and these kinds of decisions, they all have an ethical standard that's an ideal that you want them all to follow, and maybe an occasional one is pure. Everyone else, when push comes to shove, they have their own biases and things slip in. But okay, we'll put that to the side. You could say, well, let's not put it to the side for a minute. I said, should we role play this a little bit and make and worry about what could happen to our job and the politics? But you could also say, let's play this straight down the line. Let's do this and not give anyone any beneficial treatment. And that's a reasonable way to play it. Thankfully, we don't have to we've not hit that yet. We've not hit that decision yet. Let's look up her drugs. Okay, we'll talk about it when it comes to it, but I have a feeling that this group here does not want me making any political decisions. So we'll talk about that when it comes. Okay, let's see what she's got here. And we should also look up this GERD and look up her past medical history. Okay, so what are our drugs? Okay, seasonal allergy is the fluticasone. Okay, so she's got seasonal allergies. What else is she taking? She's taking this, yeah, this is an amphetamine related drug for ADHD. Side effects include vomiting, dizziness, increased heart rate, and blood pressure. Overdose symptoms include dilated pupils, confusion, panic. Can also test positive for amphetamine. Okay, this looks like her symptoms. Increased heart rate and blood pressure. So is she abusing lisdexamfetamine? Supposed to be for ADHD, but she's really using it as an amphetamine speed to get more work done. If you had to guess, that might be what you'd guess. However, no headache mentioned here. So maybe not. Okay, what about her omeprazole? Okay, so yes, indeed, it was acid in the stomach. Treats GERD. That's the gastrointestinal reflux disease. That's what it's going to be. So the acid comes up out of the stomach and irritates the throat, etc. Now, there is a side effect from this, which is headache. However, she's not having any vomiting and stomach pain. And then what's the last thing she's taken? What is this? Tolvaptan. Slows kidney function decline because she's got kidney disease. Vomiting, trouble breathing, and stomach pain, which she doesn't seem to be suffering from. Okay, so she's got kidney disease, she's got ADHD, she's got her seasonal allergies. She's taking medicine for most of these things. She's taking allergy medicine. She's taking acid reflux medicine for her gastrointestinal. Let's just look those up so that we know that we're not overlooking any detail. Conditions. Okay, here's her reflux disease, GERD. Stomach contents persistently come up into the throat. Okay, and then she's got kidney disease. What are we told? We're told exactly what kind. Autosomal dominant polycystic kidney disease. I think that means she's got some cysts in her kidney. Chronic kidney disease. Seems to me I remember seeing something about that, but I don't see it specifically in here now. So we know all of the different kidney diseases make it hard to get rid of stuff. Toxins, you could imagine the drugs could build up. I don't know if you need, oh, here. Polycystic kidney disease, see genetics. Interesting. You could see how this would be a little subtle thing. Here we go. So it's a dominant, that means who you inherit it from. Polycystic kidney disease, dominant genetic disorder in which, so if you have even one parent with it, you could get it. Cysts are formed in the kidneys. Patient may develop blood in urine. Okay. Well, that doesn't really help us. All we need to know is she's taking medication for it at the moment. It doesn't seem like it would be responsible for her current stuff. And iodine allergy. So when we're thinking about giving her a CAT scan or an MRI, we need to be aware of that. Let me just look up the procedures so we know about which ones, just for fun here, just so we remember this and don't forget it. So contrast dye is often used to improve quality. So there you go. So a CAT scan is the one that they give the contrast dye. Maybe they give it to the MRI too. I don't think so. No, MRI doesn't look like it. Okay, so we got to be careful about giving her a CAT scan or iodine. I don't know if there's other issues with iodine, vitamins and supplements. No entry in vitamins and substances for iodine. Okay. So that's our girl here. Okay. Let's read here. You could be using more now. She's on the campaign trail. We have to be careful about her. All her symptoms can be caused by her medication. They could be masking something more serious. We need to check after we deal with the kid. Polycystic kidney disease slowly kills the kidneys. Most folks either end up on dialysis or getting a transplant, I see. Hereditary and almost always passed on. She likely has given it to her kids. Kidney failure can increase blood pressure. Yes, you can have IV dye with an MRI or a CAT scan. Okay, that's good to know. Now, let's return to our kid for a second. We're just doing our preliminary sort of brainstorming here. So he's had Narcan for his overdose, and he's got some symptoms. So let's look up and remind ourselves about Narcan and stuff, and rebound from Narcan, which we remember there is something that happens when the opium kicks back in. And we'll look up Narcan here too. So I think one of our conditions talks about rebound from Narcan. Let's see if we can find that. We might want to look up any legal issue. Overdose. A person in need of medical care for a drug-related overdose may not be arrested. Okay, keep that in mind. All right, let's find rebound overdose. Here we go. Occurs after an opioid overdose is treated with naloxone, and Narcan is the generic form of that, and the naloxone wears off before the original opioid levels in a patient's system drop below overdose. Closely monitor for at least 2 hours after naloxone use to catch and treat a rebound overdose. If it happens before more serious effects can occur. If it happens before more serious, treat with another dose of naloxone. Okay, so this is our primary concern with, well, at least one of our major concerns with this kid, that he's had a serious overdose. They've given him some nasal sprays of Narcan, and it's going to wear off, and then he's going to have another overdose. Closely monitor. Okay. And now let's look up let's just look up our Narcan. Naloxone is the generic form of Narcan. And here's our Narcan. Counteracts opioid overdose, effective for 30 to 120 minutes, and then you could have a rebound. Can cause sudden withdrawal symptoms. If given to a person with opioids in their system, patient may act angry. Narcan has no effect or side effects on people who have no opioids. Okay, so that could be why he's angry. Pain all over. Okay, now let me just look at his intake again. We're taking our time getting started here because we don't want to mess this up. Okay, when was he brought in? He gets an anonymous call, hung up, They drove, they found the kid. He says someone beat him up and stole his wallet. Laceration on his head, favoring his right arm. When was the last time you had something to drink? Then the phone call rings. He sends it to voicemail. He shivers. Looks like he might be ready to throw up again. Busy day. So we don't know how long it's been since this call about his overdose. But very likely less than the 2-hour maximum effect of the Narcan. All right, let's take a look at our options here then. Remember that normally we like to interview them a little bit. This John Doe doesn't sound like he wants to be interviewed much. Okay, so our kid that overdosed, we can do a whole bunch of tests on him. If we think his back is injured, we might do an MRI on his spine. CPR, monitor sutures, and then we can give him drugs. So you could see that probably our most likely action with this guy is just to monitor him. And then we're going to need to give him another naloxone is my guess. If I had to guess, quick triage of this guy, just send someone to monitor him for the first signs that he's going to have an overdose rebound, and then give him more naloxone. If he starts to react badly, and not try to mess with his, back pain is back pain. It's not like he's complaining of a broken spine. He does have a head laceration though, so it's possible that he's got a concussion or something, but that normally takes care of himself. You could give him sutures for his head injury while you're observing him. So that's my first guess here. Now, let's take a look at Senator. So my first thing is that, the first thing we should do is our first action might be just to monitor this guy. Now, let's just brainstorm here a little bit about the Senator. We think maybe she's just reacting to having too much amphetamine. I know the lorazepam is used for people who are anxious in front of with the doctor, or who are having I just want to see, is that what's happening, and should we just be giving her, it's kind of crazy to be giving her more drugs, but I wonder. So the lorazepam is used to treat anxiety as well, to stop a seizure. Maybe that's going too far. But what else? What are the other drugs we can give her? Labatol. I guess these sound like for hypertension, high blood pressure. Okay, we wouldn't be giving her lisinopril because it reacts badly to kidney disease. So for sure, we won't be giving her that. Extremely high blood pressure, that would be our first choice here. We give her IV to deal with an acute kidney injury, which is not what's happening, but we could give her labatol. She's got her extreme high blood pressure. Is her blood pressure extremely high? Not really. I mean, maybe it is. What's normal resting blood pressure? But it shows it in the middle range here, so I guess it's not super high. Hmm. I mean, this kid's pretty uncooperative. I don't know if he's going to react well to sutures. That not even sure that's a high priority for us. Sutures to sew up his wound. Let him have a scar. That just doesn't seem like that should be our high. With a busy hospital, 2 patients, I don't think worrying about suturing his laceration is all that high on my list, seeing as how he could have a rebound overdose. So I guess I'm going to pitch this as our first action to monitor. We could also do a drug panel to see exactly what drugs he had. I guess it's possible that... So the question is, someone could get Narcan and not have an opioid overdose, but it has no effect, should have no effect. So I think we know that he's had opioids, and I don't think it matters. I mean, he could have combined them. So I guess if you ran a drug panel, you would know a little bit more. But to me, it feels like, I mean, maybe I wouldn't choose monitor the patient if we didn't have this very specific discussion of advised treatment for Narcan. Can cause sudden withdrawal symptoms if given to a person with opioid. Can cause sudden withdrawal. If given to a person with opioids in their system, patient may act angry. But then it says, see rebound overdose. That's the part that I'm most concerned about. And the naloxone wears off before the original opioid levels drop. Closely monitor patients for at least 2 hours after naloxone use to catch and treat a rebound overdose. Treat with another dose of naloxone. So it feels to me like maybe what we should be doing with this overdose guy for the first 2 hours here is just monitor him very closely and be ready to give him another naloxone. Guess you could argue we should suture him up. I'm reading this as being the choice if we think he might have a rebound. So I think this is what we do with this guy. And then we just have them keep monitoring him while we deal with this woman. All right, so I think that's what we should do. I think we should monitor him as our start. We don't know how long it's been. Probably it's been, what, maybe half an hour? Please test for drugs first, Jesse. Monitor just means you watch and don't do anything. What about... Neither of these people have interview? Let me just... Did we forget to take her story card? Let's just make sure, because... Normally we start out with their story card. Normally we take out with a story card that lets us ask some questions, but apparently not here. There's no interviewing either of these people. Normally the interview stuff would be at the top, so we can't update them. Okay. Boy, there's no other game that we play on this channel where the chat is so insistent about things. Because Debbie and Melissa are teamed up. You need to test for drugs. We need to know what he took. First thing for both should be blood tests. Find out what he took. Wow, all right. I mean, I feel like I agree with that. But now, as far as the senator... All right, let me just see. The channel is very hard. Melissa and Debbie are very strongly want to do a blood test. And I guess for the kid, you want to do a drug panel, huh? A separate test is required to screen for synthetic opioids. Where's our synthetic drugs? There must be some separate process for synthetic drugs. Depending on the drug, can show positive for substance use in the past week. The tropin test to take a sign of a heart attack. Well, we can certainly narrow it down, right? We're either going to do a drug panel on him or monitor him. And then for her, you want to do a blood test to see if she's having a heart attack, I guess. Even though her heart rate is normal. Nelbrit's in the list of exams. Don't know what you're talking about. Sorry, I'm trying to keep cool, but this is what I do every day. Every day. I know it's not the same, but I can't help thinking the way I do. Monitoring just means waiting until something bad happens. We want to prevent this if possible. No one thinks we should suture his laceration as first order of business. Nelson was saying that we've got a synthetic opioid explicit test on our booklet here. Okay, so yes. So we could do a drug panel on him and then separately, good observation, separately specifically test for synthetic opioids. Might be fentanyl? Monitoring is just waiting. This is a little bit of a game decision here. This is partly why I'm struggling with this. Like, is monitoring basically say do nothing? Or is this an important action that's going to catch his rebound overdose? Whereas if we do other stuff, we're like sending him to a different office where this emergency is going to happen because no one was monitoring him. That's a little bit of my concern. My concern is that from a game perspective, if you don't choose to monitor him, it means you're going to overlook his rebound. Is there an entry for monitor procedures? Monitor a patient. Observe a patient at risk so action be taken immediately if there's an emergency. Yeah, that's a really tough call. Let me ask you something. Those of you who want to do drug tests on him, what are you hoping to discover? What's your theory here? What are you going to discover in his drug panel? You're not sewing up his laceration. What are you hoping to find? You know he's taken opioids, right? Because he's had Narcan and he's had an effect to he's clearly having a response to the Narcan, which feels to me like that is the confirmation that he's had opioids. Now, he may have some other drugs. Maybe you find out he's taking also cocaine and mixing it up. He's having an 8-ball and combining his cocaine with his opioids. But how does how does that affect what we do? I mean, we do a drug test. In what scenario does that drug test come back and change what we do? Like, I'm not disagreeing that you might not find something interesting from the drug test, but let me just see. Let's say he comes back and his blood is full of codeine or cocaine. It's not even, we don't even have an entry for those things. I just don't know how that would, it might be interesting. I just don't know how it affects our treatment. We want to know what he took. You don't know he took opiates, but don't we? Don't we know that he took opiates? He's clearly been given Narcan. And we're told very clearly that Narcan has no effect or side effects on people who have no opioids. So I don't see how the information from the drug test is going to be useful to us. Commonly used street drugs: cocaine, amphetamine, marijuana, opioids. I mean, I just don't know. I think I'm going to disagree with the chat here. Just because someone gave him Narcan doesn't mean you know. Well, just because someone gave him Narcan, we don't know, but we gave him Narcan and now he's showing clear signs of reaction to Narcan with his runny nose and all that. So I just don't. Appears to have been roughed up. Bleeding facial laceration. You don't want to suture up his laceration? Young man shivers. It looks like he might be ready to throw up again. All right, we're going to take a break for 8 minutes. We've been talking for an hour. I can see how this may be very frustrating to a whole wide range of people watching this, but this is our last set of cases in this box. We waited a year for this, so we're going to take our time. I don't think the chat's going to be too happy with me, but I'm inclined to observe this guy, but we'll discuss it when we come back in 8 minutes. All right, we're back. We're having a little bit of a conflict here. The chat has very strongly wants to do a blood test on him. I think the heart of our problem here has to do with whether we think this monitor action is a do nothing action or whether it would catch behavior that doing something else wouldn't. So the chief argument in the chat seems to be, why bother choosing to monitor when we could just do anything else and they'll just be monitoring it as a side effect? And that this would be the option that says do nothing. So this is the kind of game that I can see how you would get frustrated. Sometimes we play cooperative games and one has to choose one's battles. I think you could make a very convincing case, Debbie, that doing anything would include monitoring the patient as a side effect. And that you should never choose to explicitly monitor the patient. You could do anything else and it would include monitoring him. But I think you could also make a case that it is a special action that includes more detailed monitoring or more quick response to monitoring. Moses says he might be schizophrenic. He'll not answer us because he's having an episode. But if that's true, our blood test is not, our drug panel's not going to show it, because it's just testing for street drugs, and we know he's had Narcan and he's reacting to the Narcan. It seems fairly clear to me he's reacting to the Narcan. So I'm going to override the chat here. I'm not saying I'm 100% convinced it's the right thing to do, but I am going to override the chat. Now, don't freak out. Don't freak out. There'll be other times I'm going to defer to you. I have in the past. I'm not saying I know better than the medical professionals. I'm just saying that I'm the one who's got to make the decisions. And in my view right now, there's nothing. The most important thing is to very closely monitor him, not have a intern take his blood. And I've got other things to do. So I'm going to just monitor this guy. He's got his naloxone. I think there's a good chance he's going to have a rebound overdose. And I want to be ready for it. So that's what I'm going to do here. So we're going to John Doe monitor. And I'm taking this action to mean we are going to have someone trained to spot an overdose rebound, keeping a very close eye on him. Is this a mistake? Am I wasting a time slot? Quite possibly. But that's what we're doing. That's what I get paid to do. Listen to all your advices and not always do what you advise. Doesn't mean I don't think you know what you're doing. It just means that. Okay, HQL takes story card 90 for John Doe. Story card 90. Even though the hospital is extremely short-staffed right now, you decide to dedicate one of the few available nurses to monitor the John Doe. He'll be under constant surveillance while you continue your rounds. Okay, so what has happened here? You can see from a game perspective, it has had an effect. It's given us a card with this eye that is going to be checked at some point, and it has told us from story perspective that this hospital is so busy that if we hadn't chosen to do this, people are going to leave him alone for periods of time. But now we've dedicated someone to keeping a close eye on him. So I think I was vindicated in one sense. Whether this is the right thing to do now or not, this is clearly having an effect. We aren't just monitoring him for that half hour. We're now saying someone is going to be very closely watching his condition for the time being going forward. Okay, so that action has had an effect. Now we could do some other stuff, at least knowing that someone's monitoring him. But Melissa says something very accurate. What has happened is you have pissed off the nurses. Okay, that's good. That's good. All right, that's all fair. So now we've got someone monitoring him, and now we're back to our same situation where nothing else has changed. We don't have an update to do for a couple hours. Now that he's under close monitoring, I feel like maybe we could move on. We could also run blood test on him, but let's let the nurse observe him and see if she notices anything while we're doing other stuff. Probably not going to trigger until the time stamp. But okay, let's talk about the senator now. Even if we're not, even if we want to do something from his list first, let's talk about what we are going to do for this senator. She's got headache, she's got elevated blood pressure, and elevated, although the channel says her breathing really isn't elevated. And we think she may be abusing amphetamine. So let's consider that. That's our guess. Our guess is she's abusing amphetamine. So I guess the two questions I have for you are, what are we worried about? And what would we do if we decided she was abusing amphetamine? So I gather that that our medical specialists were particularly interested in doing a blood test to find troponin. Because of concern that she might be having a heart attack. So we could also do a toxicology and see if she's got elevated methamphetamine in her system. Is that an option for us? Yes, we could do a toxicology screen. So if our theory is right that she's abusing methamphetamine, I guess the toxicology screening would catch that. Tell us how much. That seems like a reasonable thing, but maybe you're worried about heart attack first. She is having a headache. That's the only thing that's concerning me. Now, let's say she was having a heart attack. What would we do? Let's see, we found the troponin, suggesting she's having a heart attack. She doesn't have a heart murmur. Does she have hypertension? Treat with blood pressure lowering medications like Labatol, lisinopril, or sodium. So why? I mean, that's an option for us. Normally not in the blood, only released when the heart is damaged. Also from drug toxicity and stroke. He's getting a little nervous just being in the hospital, though. So I guess I could see the case being made that we should test for troponin to see if she's had a heart attack. And I do think toxicology to check for if she's abusing the amphetamine. But I guess either way, even if you found out she was abusing the amphetamine, you'd want to test for heart damage. And if you find the troponin, that might be the first thing you treat. Okay, let's see how the chat feels about that. She's complaining of chest pain. We need to check for heart attack, which could be a serious condition. If we don't calm her down, do a troponin. Okay, you don't need the tox screen. You know she uses the med. It's only positive or negative test. Doesn't say how much. Okay, well, that would be important. Okay, so troponin is the consensus here. Let's find out if she's had a heart attack and doesn't know it. Fair enough. Troponin it is. All right, so the next test we're doing on the senator, we're going to do the troponin test. Let's find out if she's had a heart attack. If she has, that's our first order of business. Blood test troponin in the first period, MEV. Okay, let's see what we've got here. MEV, GMM. If you have revealed a card with an I, take story card 9. Otherwise, take story card 7. So let me just point out, the fact that we're monitoring this kid just got checked for. Basically, I think what we're being told is that something's happening to this kid while we were checking on our lady. So because we have this I, we're taking 9. But its story card, should we be, it's a little confusing, like, is it her story card only? It seems like it's asking us if we've taken an I for everyone, for anyone, which we have. But let's take a look at it. You start to explain to Senator Perez what action you intend to take when you hear shouting down the hall. Then you hear someone call urgently for you. Excuse me, you say as you get up. You're leaving me again? For that drug addict, aren't you? Says Senator Perez. When you don't answer, she throws up her hands. You've got to be kidding me. You don't wait to hear what else she has to say. Down the hall, you can see the nurse you left to monitor the John Doe. He's unconscious. It's a good thing you had her monitoring him. Who knows how long he would have been like this before anyone noticed. Take story card 63. You know, are these interweaved in some way? That's a 63. Yes, they are. Okay, I see. So hers go from 1 to 50 40, and his go from 51 on. Okay, so you don't have to figure out what deck they're talking about. Okay, so I don't want to pat myself on the back too much, but I will a little bit. This is telling us it's a good thing you had her monitoring him. Just saying. I'm just saying. So the senator didn't like that, and we weren't able to even do it because this triggered. The John Doe is unresponsive. His arms are limp. You check his pupils and they're constricted. His face is blue and he's not breathing. Code blue emergency. You're unable to complete this action. Cross it out on the patient form. Consider this time slot used. So in other words, we didn't do the troponin test. If your next action does not result in emergency resolved, ignore the action and take story card 71. So I'm assuming that he's had the opioid rebound and that we should give him another Narcan shot. But now I do want to know from the experts if you've got any alternative. But Melissa said we've just killed him. Well, you could be right, but I don't know that a blood test would have helped us. Okay, but Melissa's not happy. All right, so now let's focus, though. Let's focus on our patient. What do we do for Code Blue? Do we give him the Narcan, or do we save him some other way? Let's look it up. If your next action, then take story card. This guy could be dying on us right now. All right, so we're not told to take a new status card, which I don't know why that is. It seems like we should have a new status card, but we don't. So these are the only actions we have. So it seems to me it's the naloxone. It's odd that it's not giving us a new state card. That would be the most logical thing. We should have a new card that says he's unconscious. Oh, but we do have CPR. Huh. Well, that's tricky. All right, let's read about it. Let's read about it. It's either, surely it's going to be naloxone or CPR. All right, let's see what we've got here. Okay, so naloxone and Narcan counteracts opioid overdose. I mean, surely he's having an opioid overdose. So it feels to me like he should get Narcan, but let's look up CPR. Life-saving technique used in emergencies when a person's breathing or heartbeat has stopped. So you think we do CPR and then we give him the Narcan? First, we got to get his heart beating. I mean, it feels like he should be doing these both at the same time. Can we get his heart fixed if he's having an overdose? Or should we be giving him the Narcan? Well, you have a good point. If Narcan is... I mean, Narcan was a nasal spray that the person on the street gave him. So you wouldn't be able to take that if you're not breathing. So in that case, you'd have to do CPR first. But can't you give Narcan in a shot? But I guess if the heart's not beating, it's not pumping blood. Okay, let's think of it that way. If his heart's not beating, then, well, we don't know his heart's not beating, but he's unresponsive. Pupils are constricted. What does that tell us? Pupils are constricted. Does that tell us anything? Can I have an entry on pupils constricted? No. Treat with another dose of... All right, where's our medical expert now? Debbie's like, you killed him, and she dipped out. All right, come on, Debbie. I mean, not Debbie, Melissa. I think we got to give him CPR and get his heart going. And then we can give him more Narcan. It's just a little troubling. It's a little troubling that we think it's the Narcan that he needs to stop the overdose. And yet... I wish we had an entry on pupils constricted. Narcan won't restart breathing. That's stopped. All right, I guess we're going to do a CPR. It's a code blue. He's not breathing. I guess we got to do CPR on him. But he's clearly having an overdose. I wish we had more information about Narcan. Like, what did they suggest that he's not breathing? If your next action does not result. Okay, so we're gonna get... We don't know that his heart's breathing, but he's dying and he's not breathing. I mean, we don't even know why he's not breathing, but heart stopped, he's died. Surely we need to do CPR. Can you imagine taking this long with a real patient sitting there? You just have to do it. Life-saving when a person's breathing or heartbeat is stopped. Okay, we're going to do CPR on this guy. So on our John Doe, we're doing CPR. The senator can pound rock. Oh, VDK. All right, Melissa, come back. Come back. VDK. All right, here we go. Let's hope we can save him. I mean, I want to give him Narcan too, but I guess we're doing this first. Result code GMM. That seems like the same thing we already did. That's weird. Story card 9. It's the same story card. Story card 63. That's weird. Did I do something wrong? Something's gone wrong here. It's telling us to take the same card we already have. Why would that be? Hmm. Oh, I looked it up on her. Sorry, I looked it up on her. Okay, that explains it. Well, it's good that didn't break things. That could have been a disaster. Okay, so CPR on him is AEB. So no matter what I had tried to do on her, this guy's triggering. Okay. God, what would have happened if we weren't mentioning him? So we lost our second action. Now we're doing CPR on this guy. Boy, you got to be careful about that. All right. We're not giving him naloxone, or not giving him, yeah, naloxone. We're giving him CPR. AEB. Okay, here we go. Here's where we're gonna find out if this guy's dead or not. If you're in the middle of an emergency, see VMM. Well, we certainly are in the middle of an emergency. VMM takes story card 74. All right, let's see. Is he going to be dead or not? Or did we resuscitate him? Chest compressions followed by mouth-to-mouth resuscitation are exactly what's needed. The John Doe suddenly takes a breath on his own. Emergency resolved. You check his heart rate and it's low. His breathing is slow and shallow as well. Avadagrajara, he mumbles. He's not clear of danger yet. Emergency. Choose another action as part of this same action. So clearly we're giving him his Narcan now, yeah? Can we all agree? He's having an overdose rebound and he needs another shot of Narcan. All right, so we are now going to give him over here. We're now going to give him the naloxone, which is the generic Narcan, or vice versa. Yeah, naloxone is the generic form of Narcan. Okay, so are we agreed that it's all about naloxone is WLA, and we're giving it to the kid? And let's see how that works out for us. Meanwhile, the senator is not happy with us, but she can deal with it. WLA. If you have revealed a card with the bed, which we have right there, GKP. GKP. If you've revealed a card with a little kiss, which we have, NEA. NEA. You call for naloxone. Nurse Judy retrieves a nasal spray bottle from a nearby cabinet. As you lift John Doe's head, she inserts the bottle tip into his nose. Emergency resolved. Take story card 66. So it was a spray. So if we hadn't got his heart working, it wouldn't have worked. So it did resolve the emergency. And note that if it hadn't, he'd have died. So let's see if he's stable now. John Doe relaxes. Looks like the worst is over. You realize that the previous dose of Narcan he was given must have worn off, and he's having a rebound overdose, since at least one of the other drugs in his system is still at overdose levels. The naloxone you just gave him will stabilize him. He no longer needs continuous monitoring. Emergency resolved. Take story card 60. This is still the third action, says the chat. I think you are absolutely right. I wish this card was better. But what Nelson is pointing out is this says choose another action as part of this same action. So we didn't have to eat up another time for that. It did let us give him the naloxone as part of our action, part of our same action here. Okay, so look at what we've got here. He's stabilized. He no longer needs continuous monitoring. So I think the worst for him is over. Take story card 60. Let's see how that goes. See if he's in a better mood now. The John Doe suddenly sits up, his eyes wide. Where am I? He looks around the room like a wild animal. Who the fuck are you? He steps closer and he pulls away, shouting, "Don't fucking touch me!" His gaze darts from side to side. Then he gets up, ready to run. Ah! He yells, bending over in pain. "Oh, my back!" He grabs his side and his face turns a little green. "I feel like shit, and I'm in a lot of pain." In addition, all the activity has torn open his facial laceration and he's bleeding profusely. Take both story card 2, Racing Heart and Pissed Off, and status card 7, Rebound. Then take story card 1 and 51. Wow, okay, big developments here. And now his facial laceration has opened up. Okay, so status card SC2. SC2. Okay, that's not his status card. I'm afraid. Oh, our senator is not happy. So our senator went from Racing Heart to Racing Heart and Pissed Off. He's no longer just got a Racing Heart. And our John Doe, however, has gone from overdosed to rebound. So let's find his card. Okay. All right, so there's our new 2 statuses. Racing Heart and Pissed Off and Rebound. Oops, it's this way. All right, well, she's gotten worse, but he's gotten better. Now, story card 1 and 51. It sounds like now we're at Act 2 of our story. So we're getting the story card from each of our people. The first story card for each of our people. All right, now before we move forward here, let's check in with everyone. Okay, you notice it said one of the other meds in his system. We still don't know what they all are. It did confirm he has other drugs in his system, so we need to test him for that as well. You're about to be coding her also. I think you might be right. She's going to have a heart attack now. I wonder if we don't need to calm her down before we even do any tests on her. All right, well, let's read our stories here. It did confirm he has other drugs. That's a little bit misleading to me. I mean, I don't want to get caught up in an argument about this. Perhaps we'll talk about this later. But he seems to be having a rebound overdose since at least one of the other drugs in his system is still at overdose levels. I read that not to say that he doesn't have an opioid and something else. I read that to say that he's got naloxone now, and he's got something else still in his bloodstream, which is an opioid. Okay, well, let's read our stories before we continue. I see, it's just interview cards. Okay, so we could now interview John Doe. What's your name? How can we reach your parents? What drugs did you take? What happened? Why are you bruised? May I see your arm? How can I help? What do you need? Okay, but he's bleeding profusely from his head. So that's probably, we should deal with that before we ask him any questions. But let's see what we've got here for Senator Carmen Perez. She's extremely agitated. Your intuition tells you to avoid making her any more upset than she already is. Tell me about your heart. What drugs are you taking? Do you check your blood pressure at home? I see you have polycystic kidney disease. Have you had any symptoms? Tell me about your campaign. Has it been stressful? Okay, so we've got our kid who's bleeding profusely from his head laceration, and we've got our potential woman who may be having a heart attack right in the waiting room. Let's consider what we want to do here. Remember, she has white coat hypertension. Her blood pressure is elevated just from being in the hospital. So I'm sort of inclined to give her lorazepam right now before we even move forward on this. Or whatever would reduce her symptoms. Okay, we've got 2 more actions in this time period. So we were in the process of doing a blood test on her troponin to find out if she's had a heart attack. I just worry that she's going to have a heart attack from being in this hospital room. And I'm wondering if we shouldn't try to get her calmed down a little bit first. And then the question is, can this guy wait on his laceration? I mean, he's bleeding profusely. That sounds like we got to treat that. All right, let's at least consider our options. The only thing for John Doe is to suture his laceration. So we will be doing that or ask him questions. But surely the next action we're going to do for John Doe is to suture his bleeding profusely laceration. So when we do his action, it's going to be that, and we're going to want to do it soon. But the question is whether this woman's potential heart attack takes higher priority. I think right now, I mean, let's look at her drugs again. We could give her. It seems to me we could do the troponin test, but I'm worried that she's so anxious. She's so anxious. She has white coat hypertension. Blood pressure reads higher in a medical setting. Let's just take a look. So we could give her right now the lorazepam. Treat anxiety. We could give her extremely high blood pressure drug right now. I don't know if that's really called for. Lisinopril, hypertension. We're certainly not giving her that because it's counterindicated with her kidney disease. And what is the sodium? Lowers blood pressure, can increase brain pressure and worsen blood flow to the heart if she's having a heart attack. So we don't want to give her that. But should we be giving her Labratol, lorazepam, or should we be testing her for a heart attack? That is tricky to me. Her heart is racing. It's not high blood pressure. It's her heart is beating. I think we give her lorazepam. Is that crazy? Do we have an entry for when the heart is beating quickly? Where's our heart booklet? Where's our heart booklet? I need to find out about with a rapidly beating heart. Irregular enlarged heart. Heart murmur. Hypertension. Abnormally high blood pressure can lead to heart failure, kidney disease. Treat with blood pressure lowering medications. Chest pain, shortness of breath, pain in one or both arms, heartburn, nausea or vomiting, sweating, fatigue. Wow. This is tough. I mean, we'd like to know the exactly what's going on. I just worry we don't have time and we should keep her from having a heart attack. Does anyone want to make a case that we should treat his laceration that's bleeding profusely before we deal with her? Any thoughts about what's priority? Can we really leave this guy bleeding profusely? Or do we have to deal with that first? I worry we're going to have a choice here between a heart attack and bleeding profusely. And that we're not going to be able to deal with both of them properly. She's either going to have a heart attack or this guy's going to bleed profusely. If it didn't say bleed profusely, then that would be one thing. torn open his facial laceration and he's bleeding profusely. I think probably bleeding profusely. We're going to have to deal with the bleeding profusely. If it didn't say profusely, that would be one thing, but this guy's going to get sutured up and then we're going to be done with him and move along to this woman. Okay, Melissa agrees. All right, so because of the profusely, I'm going to put him at higher priority for now. We're going to suture him up. And then he's just going to have to sit with his issues for a while after this. We may have to make a tough decision about her. CCH. We may have to give her some drugs blindly. CCH story card 88, just because we don't have time to properly diagnose her. Although I'm getting the impression from Melissa that that is frowned upon. All right, but Melissa agrees we're going to suture him first. You cleanse the laceration on his head. The John Doe starts to resist you. You say, I need you to calm down. You're bleeding and it needs to be stitched up. He stops struggling, allowing you to apply 7 sutures to close the laceration. All right, I don't love that. I would rather just put some gauze on him, but it had to be dealt with. All right, now we've got one time click before our senator is going to have a heart attack, I fear. Our John Doe is taken care of. So now we got to deal with this. Let's talk about our main options here. I'm afraid that she's gotten herself worked up. So let's talk about what we've been thinking about. We think she may be abusing the amphetamines, but our primary thought was to see if she's had a heart attack, and if she has, we'd be able to treat it in one way. But I guess what I'm more concerned about now is stopping a potential heart attack. So we know some of these drugs we can't give her because of kidney, but we've got one that will reduce her blood pressure and one that will calm her anxiety. Do we just give her an IV to reduce her blood pressure? Would that also calm her down? If we give her the lorazepam, are we just going to be hiding a symptom? This is tricky. So, again, we know we're not giving her the Lispronil because that's counterindicated for kidney. The Labatol is the first-line choice to treat extremely high blood pressure. So this is an IV. This is emergency treatment for high blood pressure. But is her high blood pressure extremely high? Or is this dangerous because it's not that high? Racing heart sounds different. And if we give her this sodium, lowers blood pressure, can increase brain pressure and worsen blood flow to the heart. Okay, we don't want to give her that because she may be having a heart attack as we speak. Question to me, I guess, is test lorazepam or Labatol. And am I reading too much into the lorazepam? Like, it's not really recommending it. It seems to me like it's what we should do to calm her down. But the game isn't really recommending it. What drugs? I don't think... Well, let me see. Debbie says, I don't think her blood pressure is extremely high right now. What's her heart rate again? The Labatol can lower the heart rate too. Her heart rate, we don't know it. When she came in, her heart rate was actually fairly normal. But what's happened is this. She's gotten very angry. She's gotten very angry. Yeah, we're not going to give her the sodium until we know she's needs it. Or, yeah, until we know she's not having a heart attack. So I don't think we're giving her the sodium. And we're definitely not giving her the Lisprinil. So it's either do we give her Labatol to reduce her blood pressure, extremely high blood pressure, but maybe we don't know that she has it. Or we give her lorazepam to calm her down, which I'm thinking we maybe should have given her right away. Or we could give her the test. I wish we had more. I wish it said more about the lorazepam. I don't want to make her more anxious. Consider the lorazepam, says Melissa. That's all I needed to know to give her the lorazepam. Just that Melissa was not going to get angry at me. Let's calm her down. She's upset. She needs to relax. She might not even react well to future tests. She might, in fact, just walk out. In fact, we know she's got a history of walking out. Last time she came in for a medical exam, she just left. She has white coat hypertension. She decided to leave. So we're going to give her the lorazepam. We're going to tell her Rex she loves taking drugs. I think once we give her this lorazepam, she's going to be like, okay, I'll relax. So we're giving her the lorazepam. Now, hopefully this won't hide symptoms, but it might have been better to give this to her right up front before we sutured, but here we go. I would talk to her to get some info, then check the troponin. If you give her the lorazepam, you may sedate her too much and she can't talk to you. Well, now you're changing your tune there a little bit. Where's our questions we could ask her? Like, what are we going to ask her? Tell me about your heart. What drugs are you taking? We don't look at this. Your intuition tells you to avoid making her any more upset than she already is. She's extremely agitated. No, we're going to give her the lorazepam. I don't know what else to ask her. Like, I think she's clearly, I guess what you could find out is that she's taking her blood pressure at home and it's normal. And she's just super upset when she's with us. But either way, let's lorazepam her. KLY. I think she's clearly, yeah, she needs help calming down. All right, KLY. Let's see what we got here. KLY. Take story card 35. Let's see what happens here. Takes a few minutes for the lorazepam to take effect. Senator Perez is visibly calmer. Now she's nice and calm for her heart attack. Okay. Here we go now. Update. This is the scary part. So where are our instructions about? We had some important instructions about which to read first. Start with the update for Carmen Perez, which is what it says. Okay, here we go. Ready? All right, let's take our next break first. We'll come back. We'll read the updates. Okay. There's a little bit of chat about how things have turned into a shit show. I think it would probably be a shit show. Whatever we did, that's clearly the setup. I'm not sure if the emergency means we messed up. I think it's part of the story. The only question is, what would have happened if we had given him the extra Narcan right from the start without even testing and waiting for him to rebound? But I think it was all designed to happen like this. Anyway, okay. Time to do our updates. We don't have any choice here. We're just doing these updates. So no point in discussing what we should do until we finish this. We're supposed to do Perez first, Senator Perez, and we do our 4 p.m. Sorry, 1400, which is 2 p.m. update. Here we go. So the 2 p.m. update, when she's got a racing heart and is pissed off, is YWX. I wish there was a place to write this down. There isn't. Maybe we'll just do it here. All right, this is the part I'm worried about. She's going to have a heart attack now. YWX takes story card 23. Surely she's going to start having chest pains or something. How nice of you to see me, says Senator Perez. How's the drug addict who keeps getting the cut in front of me doing? She holds up her hand. I really don't care. I'm going to make some changes over my next 4 years in office. It's absolutely criminal that a drug addict, an actual criminal, gets priority over a contributing, tax-paying, law-abiding citizen. I bet he pays nothing for his visit. That's because productive people like me are footing his bill while we have to wait to get urgent medical care. She waves her hands in front of her. Don't get me started on how the American medical system is broken. It'll just make my headache worse. All right, that headache is of a concern because I don't think we know exactly what's causing that. I think headache. She keeps talking about her headache. It's not on our normal high blood pressure list. But she hasn't had an acute heart attack yet, so that's good news for us. Now let's deal with this guy. And yeah, she's not happy with where she's been listed. Okay, AKT. Let's see how John Doe's status is. You find the John Doe sitting up in bed, scratching his left arm. His phone rings, showing a call from Mom. You say, why don't you answer it? He says, it's obvious, isn't it? I don't want her to know what's happening. You start to ask a question, and he says, she's so controlling. She even said I couldn't dye my hair. You point to his blue hair. Well, she said I couldn't dye it red. She said nothing about blue. He frowns, grabbing his back and wincing. I dyed it a week ago. She hasn't even been around to yell at me. What's the chances that these two are mother and son? That's what Melissa thinks. I mean, we did consider it. We absolutely considered it. She has an adult son and daughter, but he's 19, could be a little older. He could have kidney disease too. It's inheritable. We don't know his blood test. Hey, if we do a blood test, we might be able to figure out if he could be the kid, right? Let's just think about that for a second. If we did a blood test type on him, we know her type is B positive. So, just for fun, if we had... Let's just see this for a second. So if the mother's is B, then the child's blood type could be A or B or A, B or O. So maybe we wouldn't... No, sorry. The mother's type is B, but we don't know the father's type. The child could be A, B, or O, so it's not going to help us without knowing the father's blood type. So doing a blood type on him is not going to help us specifically. Of course, if we tested him for the kidney disease and he had it, that might be a clue. Lives with her husband, has 2 adult children, works as a senator. Let's see. He says his mother hasn't even been there for 2 weeks. What does she tell us about where she's been the last 2 weeks? Let's look at the questions we can ask them now. Okay, so no one died and she didn't have a heart attack yet. That is great news. Now, let us look at the questions we can ask. If we do have a theory that they're related, not that that really helps us, so maybe we don't, but let's see. Anything we could ask them? What's your name? Okay, so he could tell us his last name is Perez. How could we reach your parents? That might tell us a little bit about my mom's a senator. Doesn't really help us though, does it? Except for the kidney disease. But if we're done treating him, which I don't know that we are, but I'm not sure it helps us to connect these two. If it turns out to be her son, and we tell her that, hey, your son had an overdose and it's going to be in the news and it's going to be a scandal, I don't think that's going to be good for her heart attack. Yes, the only exception to everything I'm saying is that he could have her kidney disease and his back still hurts. So we could have a situation where, but we could just test for that. Maybe he's stolen some of his mother's drugs. That's an interesting idea. Yeah, let's talk about, look, he's stable. And whether it's time to work on her so we don't get completely fired. Okay, it's time to work on her. The main thing that's bothering me is her headache. Because I'm not sure we understand what could be causing that headache. So we were thinking of testing her for the troponin for a heart attack, which I think makes sense. We think she might be overdosing on amphetamine. She's not high blood pressure and headache. It's the headache that's bothering me. Lightheadedness, confusion, no. Extreme headaches, fatigue, abdominal pain, rapid heart rate, high blood pressure, aneurysm. She's got some of these, right? She's got a real headache. She doesn't have any abdominal pain. She doesn't have lightheadedness or confusion. She doesn't have sore feet. She's taking amphetamine, highly addictive. Help us, really. He's taking a whole bunch of other stuff. Slows kidney function, decline, side effects, vomiting, trouble breathing, stomach pain. She doesn't have those. That's maybe being hidden by the anti-reflux stuff she's taking. That could be hiding stomach issues. What is causing her headache? That's what I want to know. What is causing her headache? Chronic kidney disease, kidney failure, high blood pressure, bone issues. Medications like non-steroidal anti-inflammatory can worsen kidney damage. Kidney failure. Why does she have a headache? Why does she have a headache? Blood in the urine. I mean, we already know she has that. What are our options for her? We've already given her Wardsman, so I guess the only real options are to give her the blood pressure reduction medicine. We're not going to give her that without doing more tests. So I think it's either interviewing her or running some tests on her. We've already given her the lorazepam. I just wish I had some theory about the headache. Chest pain. She does have chest pains and a headache. So has she had an infarction? Chest pain, shortness of breath, pain in the arms, extreme fatigue, no headache. I don't understand that. What's causing her headache? What is causing her headache? Any theories? Melissa says her blood pressure being up can cause the headache. If she's taking too much of the meds, it can cause that also. Drug toxicity and stroke. All right, well, how about Can we get some... What do you guys want to do? Do you want to test for troponin? I guess I'm interested in a toxicology screen. Melissa thinks that it's only going to tell us whether she has the amphetamine in her system, not the amount. I'm not so sure about that. It does seem like we can't just give her a drug to reduce her blood pressure. You got to figure out what it is. But I really wish I had one of these that was focused on the headache. Or we could ask her questions now that she's calmed down. Tell me about your heart. What drugs are you taking? Do you check your blood pressure at home? Okay, so she was supposed to be checking her blood pressure at home. So we could ask her this. And if she says, yes, I check it every day and it's normal every day, then maybe we don't think that her real... We know she gets anxious talking to the doctors, so this is a reasonable thing we could ask about. And if she says, I do check it and it's normally low, then we might think, okay, really the blood pressure is just a very temporary symptom. Severe headache with no known cause. Treat immediately to reduce brain damage. Diagnosed with a brain CT scan. I wonder if we shouldn't just put her right in the CT scan. I'm not averse to running tests. I'm ready to run some tests. Debbie's getting anxious. We need to... I'm up for... I think we should be running a test. It's either tests or questions. So, you want to do a CT scan or do you want to look for the troponin? I'm ready to run tests. I'm just trying to understand. I'm focused on the headache. So I'm trying to think what tests would give us headache. So I guess I'm more interested in the CT scan because it might tell us about the headache. So let's put her in a CT scan. She's already had her lorazepam, so she should be calmed down for it. We're not going to give her the dye. Surely they'll ask us about the dye, right? So do we feel okay about a CT scan? The best thing about a CT scan, though, although we don't have any... Is there any reason we should pick CT over MRI? So CT scan, more detail, usually first imaging choice to identify disease or injury, complex bone fractures, tumors, types of heart disease, head trauma. Contrast dye is often used. All right, I think we should do a CT. But there's a little... Melissa says, I want to do both. For the headache, I would do CT. MRI takes too long. Troponin test would be nice, but I'm worried about the headache. Let's do the CT. Okay, we've come to an agreement. We're going to do a CT scan. The other advantage of the CT scan is it'll make her feel like we're doing something. a brain CT angiogram. So it's a little more specific about what we're doing. An angiogram checks for blood flow through arteries or veins, can detect aneurysms. That's what we want. And it's testing both the brain, just the brain. Okay. Brain CT scan. Okay, well, that's what we're doing. All right, let's give it a try. Melissa says, in a stroke alert, you do the CT first. An MRI takes an hour. Anxious people can't tolerate MRIs. MRI is loud. It puts you in the very confined bed. It triggers anxiety from people. Okay, I've never had one, but here we go. We're doing the brain CT, and we're in the 1400. So we're in the second thing, EUZ. We know, you're just reminding me, don't let him give her iodine. Yeah, I mean, it's surely going to ask us, right? We're going to put on our thing, CT scan, no iodine. We're assuming it's going to give us a choice here. If it doesn't, then we're going to abort. We're going to not allow them to do it. Okay, so EUZ. We know we don't want to give her the contrast dye. So if it doesn't give us that choice, which it will, then we won't go through with it. An angiogram has dye. Well, what we're told here is that contrast dye is often used. So I suppose you could look at it two ways. You could look at it that it's probably going to give us a choice, and if it doesn't give us a choice, we won't go through with it. But the other way to look at it is a CT scan therefore not the thing to do because we won't get a good reading from it without the contrast dye? Or could we use a different contrast dye than iodine? Let's try it. EUZ. I assume it's going to ask us, and maybe it'll give us a choice of what contrast dye to use. Although I'd be a little nervous about using anything on her, even if it's EUZ is story card 24. Like, what if you give her some dye that is different from iodine, but she also reacts to that? The brain CT angiogram comes back and it doesn't look good. Senator Perez has a serious aneurysm. You show her the scan. You say the aneurysm is larger than 3 millimeters, so it has a higher risk of rupturing. Senator Perez laughs. This can't be true. It's my heart that's... You say, no, it's your brain. We did good. We've been spending 3 hours discussing options, but it looks like the CT scan was the way to go. And as we suspected, it's brain related. All right, so now we've shifted to SC3. We've discovered she has an aneurysm. She doesn't have a racing heart anymore. I'm sure her heart is still racing, but we have properly diagnosed at least what's clearly the primary problem with our senator here. Okay, she's got an aneurysm. She says, I thought it was my heart. We said, nope, not the heart, it's the brain. Okay, so we did good. We did well. Now let's read a little bit about an aneurysm. Now that we know that's what she has. So like, hold on a second. I'll be right back. We go to our medical book. Abnormal bulge in a blood vessel that builds over time. A rupture can cause internal bleeding and often leads to death. Symptoms include lightheadedness, confusion, extreme headaches, fatigue, abdominal pain, rapid heart rate, high blood pressure increases the chances of developing an aneurysm and increases the chance of rupture. Diagnose with CT scan. Treat with surgery to repair the aneurysm. See stroke if an aneurysm in the brain ruptures. Okay, so it hasn't ruptured yet, but it's at high risk of rupturing. But she needs surgery. That's all there is to it. I think we just rush her right into brain surgery. There's really, I don't think there's much point in doing any other tests for her. I suppose I don't see, there's nothing else to give her, right? Like, that's the treatment. Surgery. Surgery first. Melissa says, yeah, the amphetamine isn't good. The high blood pressure isn't good. Nothing's good. But I don't think we have an option here. It's just brain surgery. That's the treatment. The sooner the better. I don't think there's anything to be done ahead of the surgery. Is there anything we need to ask her before we send her in for surgery? Should we ask her about drugs she's taking? Do we do a toxicology? Like, before surgery, is there anything we need to know from her? She's taking lots of prescription medications. None of them, though, are going to affect the surgery. I mean, they're going to have to put her under with anesthesia. So I guess the only question is, do we ask her, is there anything she could tell us that would affect that brain surgery? I don't think so. I mean, maybe we'll just pass on to the surgeon that he's probably on amphetamines, but I mean, the anesthesiologist will ask her the normal questions. But Melissa has a good point. Like, she'll just lie about it. That won't really help us. I think we just send her right for surgery. The only question is, we could do toxicology first. Don't take her word for it, but we could, all right, forget asking her questions. We don't think she's reliable. But we could do a toxicology screen. If we think, but toxicology, that's like for poisons and stuff. Lab toxicology checks for 30 substances, medicines, alcohol, illegal drugs. I don't think that's going to do it for us. I think we just send her to brain surgery. The sooner the better. What do you think? Should we just send her to brain surgery? I just don't see how she's avoiding that brain surgery. And I'm not sure there's anything she could tell us or we could find that would alter that brain surgery. Well, what do the doctors think? Where's our treatments? Is there any counterindication to surgery, brain surgery? If an aneurysm is likely to rupture, a variety of surgical procedures can divert blood flow, including microsurgical clipping, artery bypass, and occlusion, flow diversion with stents, and endovascular coiling. So do we need to know which one to recommend? A variety of surgical procedures. Microsurgical clipping, artery bypass. Do we need to give an advice about which one to do? Do we ask a neurologist for an opinion, a specialist, before we send her? I can't tell whether it's going to give us choices here or not. I feel like we've got the CT. I'm not sure really what else we would do. Either ask her or send her to surgery, huh? I don't want to get her upset. Let's just go right to surgery. JYP. We'll ask her afterwards. JYP. I don't want to delay, and I don't want to get her anxious thinking that we're like, she can't admit to drugs. She can't admit to drugs. She's a politician. It would come out in the paper. Like, she's not going to admit anything. So let's just send her into surgery. Here we go. JYP. The sooner the better. Just get her in there. We'll talk to her about what to do afterwards. Story card 39. Or we could talk to the neurologist. Okay, so that's the only other thing. Should we talk to an expert? She dies on the operating table. We're going to be in trouble. Should we talk to an expert? I feel like I don't feel like an expert. You need surgery for an aneurysm. We looked it up. That's just the treatment. Okay, here we go. You explained to Senator Perez how the surgery will stop the blood flow through the aneurysm to prevent it from rupturing. It's good we caught this early, you say. How long will it take me to recover from this surgery, she asks. Well, 3 to 6 weeks if everything goes well. That's right up to the election, she says. The polls are too close. I can't do this now. This has to wait until after the election. She stands up and begins pacing. The senator throws her hands in the air. This is bullshit. Choose. Take the time to explain things to the senator to calm her down, or you don't have time for this. Okay. So here is the advantage of sending her to surgery right now. I think we do have time to calm her down. It's 14:24. I think as long as we get her into surgery, before in the next little bit, we're okay. So I think the fact that we caught it quickly, we gave her the lorazepam, I think we're going to be okay to explain this to her. We can't afford her getting more anxious. So we're going to calm her down. Yeah? Everyone's in agreement. We're going to calm her down. Story card 8. Like, we have to be careful with this woman. I understand this must be very disappointing, you say. I can only imagine how difficult it is to make this decision. I've got a lot riding on this election, she says. I can't win if I'm not out there campaigning. Isn't there a drug I can take to hold the aneurysm off? You say, well, you should know that 2/3 of the people who experience a rupture have permanent brain damage. You might lose a lot more than an election. And what about your family? Suddenly, she looks very old and tired. After a few minutes of talking, she says, all right, do the surgery. On your patient chart, cross out the next available action with an X. So because we took the time, we lose this block. I think that was clearly the right thing to do. All right. So we've done the surgery, but it took us a little bit more time. Take story card 26. Let's just hope it went well, or we're going to be in the middle of a lawsuit, the whole hospital. Whoa. The surgery proceeds smoothly. You cut into the center of scalp and skull to expose where the aneurysm is located. Then you place a metal clip over the weak area of the brain blood vessel where the aneurysm is. When another nurse bursts into the surgery room, it's the young man. He's bent over double and screaming in pain. No one else is available to ask, should I give him ibuprofen, oxycodone, or Vicodin? He's doubled over in pain. He's got back issues, maybe kidney issue. Should I give him ibuprofen, oxycodone, or Vicodin? Well, surely we're not going to give him we're not going to give him an opioid because the Narcan is going to block it. And I think that would be oxycodone. So I think the oxycodone probably doesn't work. And if we suspect kidney disease, we don't want to give him something that could interfere with kidney. So let's go look at our drugs again. So he's doubled over and screaming in pain. I mean, it could be his arm, but he's doubled over. I think it's going to be his back or something. So let's look. We don't want to give him kidney affecting drugs, and we don't want to give him the drugs that the Narcan would block. So where is our ibuprofen? Non-steroidal, anti-inflammatory, can worsen kidney function. Okay, no ibuprofen. And oxycodone is probably going to not work on him. Opioid. So the Narcan is going to block the effectiveness of that. So if you tried to give him oxycodone, it wouldn't even work on him. So I think it's Vicodin. Oh, it's an opioid. That won't work either. So I don't think he's going to get any pain relief. I don't think we're going to give him anything. I suppose the kidney disease is the least likely, but I guess I'd rather give him none of these. Where's our Okay. We don't know that he's taken opioids. We kind of do, but all right. We don't have to decide yet, but I guess we're going to decide right here. Story card 13. I have a feeling this kid's going to be in trouble now. All right. You have 30 seconds to choose a response. Wow. Start a timer. All right, folks, what's it going to be? I don't want to give him any of these. Surely not the... I think... Boy, the kidney disease is a long shot. So it's either it's not the oxycodone or Vicodin. Those are not going to have an effect. So it's either the ibuprofen or I'm in the middle of an operation. So I'm going to say I'm in the middle of an operation. I'll see him as soon as I'm done. But if he has to have it, don't give him any pain medication. If he has to have it, then it's going to be ibuprofen. The other two won't work. The other two won't work. You can't give him oxy. It won't work. Oxycodone is going to be an opioid. Okay, so that's it. I'm in the middle of an operation. I'll see him as soon as I'm done. If he needs something, give him ibuprofen and monitor the kidney. Story card 30. I mean, really, this fucking kid. We're in the middle of a surgery. Deal with it, deal with it, deal with it. The surgery is done in a few minutes. You have the assistant complete the sutures. As you clean up, you hope you did enough to help the center return to living a normal life. Look through all the cards. Find all the cards with the angry and happy. If you have more angry than happy, take story card 32. Okay, let's see what we've got. So we've got angry and happy. Here's another happy. We've got two happies and two angries. Because we gave her the lorazepam and we took the time to explain it to her. So because of that, we beat this test. If you have more angry than happy, story card 32, but we don't. We have equal numbers, so we get story card 31. Which is her not in too much distress, I think. Congratulations, Senator Carmen Perez will survive the night. The surgery was a success. Despite the tremendous stress Senator Perez puts herself and those around her under, she's pulled through. You know what we could do? We could look and see if we think they're related. What do you think? They got similar noses. Kind of similar mouths. They could be related. All right, SC5, she's recovering. That's good. And she will survive the night. That seems to be telling us that the worst is over for her. Story card 33. Did we take that yet? No. 33. Let's see if we're going to find out that's her son. That's going to be the fascinating part. You still have the John Doe to take care of. Hold off on filling out your final report for Senator Perez. Do not read the senator's epilogue yet. You hurried to John Doe's room to see how he's doing. It's take status card SC8 in extreme pain. If you told the nurse to give him pain medication, CHLA, otherwise GWN. Okay, so I said don't give it to him. So I don't know if that's going to be trouble or not, but let's take his status. So he's in extreme pain, and I told her not to give him pain medication. I did. There's no way around it. That's what I told her. So GWN. That could have been a bad mistake on some long shot that they're related and he has kidney disease. That seems a long shot for sure. But that is what I did. So he's not rebounded anymore. So she's recovering. He's in extreme pain. Okay, so now I told her not to give him any pain medication. So GWN, here we go. Does anyone think I made a mistake? Melissa says the Narcan has stopped working. It would be a great start if they're related. She's going to be pissed when she finds out and then mad we didn't give him pain meds. Well, GWN, let's see what happens. Okay, GWN is story card 68. Let's see what he's going to say from not getting pain meds. I mean, ibuprofen, how much was that really going to do? The John Doe is curled up in bed, breathing heavily, perhaps even crying. Nurse Judy takes him into the hall and says, I'm concerned about his well-being. She looks back into the room as John Doe groans. I've stationed another nurse to monitor him regularly in case he has another episode. Okay, look for cards with these symbols. All right, I think that's the only symbol we have of his. Feels like maybe one of them would have gotten from a questions. I'm a little concerned that we have so few of these symbols. So we just have this symbol. Have you revealed 4 or more of them? If you have, take story card 92. Okay, well, we certainly haven't. So nothing triggers from this. I guess he's going to be in a bad mood. All right, well, it's time to focus on him. What should we do? I guess we could ask her some questions too if we want to find out if they're related. Okay, so but look at this. Here's our pain medications: ibuprofen, Vicodin, oxycodone. So I don't think those are going to have, these aren't going to have an effect, and this one is counterindicated for kidney. So if that's the only reason I didn't give him the ibuprofen, because I fear that they're related and he's got kidney thing. So I think the thing to do is to test him for that kidney disease, and if he doesn't have it, give him the ibuprofen. And then maybe see if he's got back injury. He has been complaining of general pain all over. That's just probably thing. Right arm, back unknown. And what are we just told here? He's really in pain. In case he has another episode. We need to be serious about this now. We need to be serious. Okay, so if we do him a Chem 7, we can find out if he has kidney problems. So a Chem 7 would be for kidney problems, and then once we find out he doesn't have Chem 7, we could give him ibuprofen. Or we could test him for other drugs. MRI spine. There are other pain medicines. Are there other pain medicines on this list? We've got a whole bunch of... Oh yeah, there's acetaminophen. That's interesting. That's sneaky. Good catch. Acetaminophen, first-line treatment for mild to moderate pain. Taking with alcohol risks kidney damage. Wow. Now we got to worry about whether he's got alcohol for kidney damage. So ibuprofen, all of this stuff affects your kidneys. This is just, I guess it makes sense. Can worsen kidney function in someone with chronic kidney disease. The rest of these are antibiotic, IV fluids. I don't think we can do an MRI on him when he's curled up. It's not going to work. It's not going to work. We've got to relieve his pain a little bit before we can put him on in a machine. Taking more than is recommended or combining with alcohol. I'm not sure he's going to talk to us when he's in so much pain either. What drugs did you take? Is he going to even tell us the truth? I don't see how we can trust him. I mean, it has been a while since we gave him the naloxone. It's been 2 hours. Maybe the naloxone is gone from his system? I don't think so. I don't believe it. I don't believe these other pain medications can work on him. That's tricky. All right, well, let me just verbalize what I'm thinking. He's curled over. He can't even talk. He's in so much pain. The nurse is worried about his physical well-being from pain. I held off giving him the opioid-related painkillers because of the naloxone would block it. But I wonder if now it's worn off. So Melissa, I think now I'm a little bit more friendly to the idea that maybe now we can give him the opioid pain relief. Probably 2 hours later, the naloxone has worn off. A little bit of disagreement here. I mean, he just OD'd. He just overdosed on opioids. Are we really going to give him an opioid painkiller? That just seems a little crazy to me. That just seems a little crazy to me to give this kid who's overdosing an opioid. But has it been enough time that it would work? Wow, that's tough. That's tough. Well, we're going to have to give him some pain medication in order to proceed any further. The other option is for us to do some tests to find out if he has kidney issues or what other drugs he might have taken. I don't think we're going to be able to X-ray or MRI him. All right, well, what's it going to be? Here are the choices I'm giving you. We can drug panel him. We can test for kidney disease, which I think is Chem 7. We could give him one of the boring painkillers that would affect his kidneys if he has chronic kidney disease. How do we trust his alcohol? Blood alcohol. We don't even have an option for a blood alcohol test. There's no sign that he's drinking, but we really don't know. Or we can try to give him Vicodin or oxycodone, both of which are opioids. Severe pain combined with alcohol, life-threatening effects. We don't know if he's been drinking. I don't think we can give him Vicodin, but we could give him oxycodone. Worst case, probably it'll have no effect. Melissa says acetaminophen will not work enough and takes too long to work. Under normal circumstances, we wouldn't assume he's related to the senator. Usually you do a kidney panel test to see if any is elevated. Do the kidney test to clear that off the table. But is the ibuprofen not going to be strong enough, and so we're not even going to consider it? What's the chance that we're going to give him oxycodone and he's going to... We're not... Oxycodone... Maybe there is no worst case chance that oxycodone is going to send him into a... Like, it's just a little... Well, I'm just not sure. Nelson says from game perspective, it makes sense to give him the one that wasn't on the original list, which is acetaminophen. What's this is ibuprofen would be, well, Melissa, what about acetaminophen? Is that also like giving Tylenol? I'd give him oxycodone if I thought the Narcan is, acetaminophen is Tylenol. All right, well, we got to take a break anyway. I'll see you in 8 minutes. Okay, so we've been playing for 3.5 hours. We're going to play at least till the end of this halfway point. Lots of debate about what to do about our overdose kid here. We were in the middle of surgery when they came in saying he's doubled over in pain. I refused to give him pain medication, mainly because all of the options looked bad. We have 2 that react bad for the kidneys and 2 that are opioids. And I said it wouldn't make sense to give him an opioid. One is an opioid and bad for the kidneys. It wouldn't make sense to give him oxycodone opioid when we've just given him Narcan, because the Narcan will block it. I think, however, the oxycodone is our best option here. It's been 2 hours since we've given him the Narcan. Hopefully that's worn off. Worst case, if the Narcan hasn't worn off, then the oxy will have no effect. I guess it could have a bad effect in worsening his opioid overdose, but I think our conclusion is that at this point, a little bit of the opioid is not going to send him into another rebound overdose. And more importantly, we have to get him treated. Like, if we don't get rid of his pain, we can't do anything else. He won't answer questions. We can't do further tests. We can't MRI him, etc. So I'm going to give him the oxycodone. I think it's a little bit of a risk, but I don't feel like the others are going to cut it for whatever severe back pain he's in. Oxycodone will put him in a better mood. It's a little bit of a risk, but if he goes into another overdose, we know what to do. We'll just give him more Narcan. He'll be in a horrible mood, but we're going to see. I mean, we're going to see what happens. I'm a little bit nervous about it, but it does feel like it's probably the way to go. He's in extreme pain. I don't think the ibuprofen and the acetaminophen will do it. And we don't know if he's taken alcohol. We don't know if he's got kidney disease. It's too risky. I feel like this one has the least chance of long-term effect. But we really can't ask him any questions while he's in this much pain. So here we go. What do you think's going to happen? Is it going to have no effect because of the Narcan? What I'd like to see is if it says how long ago was the Narcan. But let's see. I'm hoping we timed it right. XRZ is story card 70. The pain medication you prescribed for the John Doe relaxes him very... God damn it. We overdosed him. Well, Narcan again. Naloxone again. HMA. There's no option, right? I mean, surely that's what it is. Yikes. HMA naloxone. Well, if you've received this, which we have, the NWT, well, we may have a bad outcome of this game. NWT. If you've received this card, which I believe we have, this is telling us we've already given it to him once. I don't think this game is going to like us giving it to him twice. UDT. All right, let's see what happens. You retrieve the naloxone spray from the counter where you left it after last time. You give him a good spray. In moments, he begins to calm as it counteracts the opiates. Emergency resolved. Take story card 68. Wow, that's rough. So 68 we already have. So now it's checking for this again. However, this time we have this. But we still only have 2 of these cards. So I wonder if it's making us... Well, I'm concerned about his well-being. All right. Well, he's not dead, so that's good. But he's in severe pain again. That was rough. All right. Well, All right, he needs pain medication. We can't give him any of the opioids. So it's either acetaminophen or ibuprofen, or I guess theoretically a test that would tell us, that would give us more choices. So acetaminophen would be first line treatment for mild to moderate. Alcohol is kidney damage. Ibuprofen says used to relieve pain. It's also an anti-inflammatory, can worsen someone with chronic kidney disease. Is he really going to have chronic kidney disease at his age? Anti-inflammatory would be good if he's got back problem. It might relieve a little bit of pressure. What was the NSAID conflict? Remember we read something that said it has a bad interaction with NSAID. Let's see. Can cause ulcers, bleeding, or holes in the stomach. Not recommended for people with kidney disease. Can we test for kidney disease first? Is he going to let us draw blood for kidney disease? That's the question. If we did a Chem 7, we would at least know about kidney. And then we would know to give him ibuprofen. What were our choices before? Was ibuprofen not on our list before? It was acetaminophen not on our list. Ibuprofen was on our list. We can't give him an x-ray. He can't move. He won't get in an x-ray machine. I mean, that's my reading of it. We don't have time before his next update. Ah, this sucks. All right, well, no matter what, we could reduce his pain. Now everyone says give him acetaminophen. Combining with alcohol risks kidney damage and liver failure. We don't know if he's been drinking. Guess we didn't smell any alcohol on his breath. But maybe he has been drinking alcohol and that's why the opioids are being strengthened. Let's look at his intake. Problem is, we can't test his blood for alcohol. We can only test his blood for kidney problems. We do a Chem 7 and find out he doesn't have kidney issues. Then we can give him ibuprofen. If we do a Chem 7 and he turns out that he does have kidney issues, then I guess we give him acetaminophen. But then he may be drinking alcohol, in which case we do damage that way. Although I guess can worsen kidney function. Maybe we just give him ibuprofen. Maybe kidney is not the biggest concern we have at the moment. Can worsen kidney function. Chronic kidney disease. We think his mother might be polycystic kidney disease. All right, I'm just going to give him the ibuprofen. If it worsens his kidneys, so be it. I don't want to give it to him not knowing how much alcohol he's taken. At least this seems like a little bit more controlled. Plus, ibuprofen swelling in the back feels like it would have another beneficial side effect since it's an anti-inflammatory. I'm a little concerned that it gave us the choice of ibuprofen earlier, which would have been better to give it to him then. All right, I'm doing it though. Nelson says give him acetaminophen instead. We can't test for alcohol. I'm going to give him ibuprofen for the swelling. I think it's better. I do think from a game perspective, it really does feel like it wants us to pick acetaminophen, but what's the chance that he has chronic kidney disease? We just give him the Chem 7 test. While he's in so much pain? I don't think we can do anything on him while he's in so much pain. He was slurring his words. Have trouble breathing. Breathing slows. I guess that's not from alcohol, though. Oh, I don't know. It seems like such a long shot to be worrying about kidney disease. But I can't tell if the game... Oh, I don't know. I don't know. All right, I'm going to leave him in pain and try to do a blood test. I don't know. I try to do a Chem 7. I don't know if it's going to work. Ah, fuck. I feel like he's in extreme pain. If we don't treat it, bad things are going to happen. It's just a matter of ibuprofen or acetaminophen. All right, let's give him the acetaminophen. I really just don't know. If he's been drinking, we're in trouble. But I keep changing my mind, so... All right, let's try it. UKC. I'm not happy about it, I gotta say, but I don't know what else to do. Story card 77. The John Doe is taking the medication, still looks somewhat uncomfortable. He says, "Can't you give me something stronger?" You advise him this is what you can safely give him at this time. He moans and throws himself back on the bed. If you've revealed a card with this, we did. 68. Well, this sucks. 68 is our same card about extreme pain. Okay, and now 4 or more of them. We still haven't. We've still got 3. 1, 2, 3. That's it. This is kind of frustrating. But I guess it's supposed to be frustrating. Well, it doesn't matter really for now. Here we are just treading water in this situation, but now we've triggered an update. So this is going to be pretty bad here. HLN update. We have not relieved his pain. if you revealed a card with this, which we haven't properly given him the proper medicine. BCK. We haven't given him ibuprofen, I guess is what it wanted us to give him. So his pain is still serious, 89. Now he's going to be in trouble. John Doe is looking pale. As you check his vitals, he says, I'm not a drug addict. I'm just in a lot of pain. You have no idea how hard my life is. No idea. He appears to be having trouble keeping his eyes open. He rubs at his arm under the blanket. My mom expects so much from me. It's unfair. She's a perfectionist who's used to everyone saying yes to her, everyone but me. He's fading fast. Can I have some water? There's something going on with him that is not related to the drugs in his system. You need to figure out what it is quickly. Okay. So he's losing it. He's losing it. But it's not the drug. It may be his kidneys. If it's looking more and more like his mother is the senator and she has chronic kidney problems. Okay. Back, kidney, x-ray. All right, well, we got a decision to make here. We can keep playing, or we can take a break and continue tomorrow. I guess I'd be inclined to keep going, but then maybe we're going to finish it today. I don't know if people want to do that. I guess let's decide that before we decide what to do. What does the group here want to do? Keep playing or break and play tomorrow? I guess I'd be open for either one. Let's see what the chat thinks. This is the group that we're playing, so whatever the group decides, I guess we can have a vote. All right, so vote whether you want to keep playing or stop. So it looks like Nelson says keep playing, Misty says keep playing, Debbie says, I think we're probably close to a solution, keep playing. What do you say, Melissa? He's been beaten up. That would not suggest kidney issue. That would suggest back injury. Just doesn't feel like we should be able to put him in a MRI without relieving his pain. I'm not a drug addict. Melissa says keep playing. Okay, so that's it. We're going to keep playing. Well, okay. We were operating under the idea that we couldn't give him more tests without relieving his pain, but the acetaminophen didn't seem to have any effect on him. Where are you bruised? How can I help? I think he just wants drugs. Can't you give me something stronger? You tell him that's what you can safely give him. And he's still in severe pain. And he says it's not the drugs. I don't know where. Oh, I guess this was the last thing we heard from him. I'm not a drug addict. I'm just in a lot of pain. You have no idea how hard my life is. He rubs at his arm under the blanket. He's fading fast. Can I have some water? Okay, he's dehydrated. Let's look at our entries for dehydration. I think maybe kidneys might be more likely than it was previously. Could give him an IV. Dehydration. Body does not have as much fluid. Commonly caused by diarrhea. Severe dehydration can lead to kidney failure. Treat with IV fluids and address the underlying cause. Okay, I think what we should do is give him IV fluids right now. He's looking pale. He's begging for water. I think we first give him IV fluids to stabilize him. And then we try to figure out if it's kidney. I'm going to give him IV fluids right now. I think he's at risk of going into another emergency shock, and I can't have that. This is not going to make things worse. I don't think this is going to make things worse. CGW. I mean, I don't like this kid anymore, but let's at least try to get him. Oh, hold on. We didn't read the status for the senator, which we should have read first. I guess we assumed she was fine, but maybe she's going to reveal her son. MAS is story card 25. I mean, she might give us a clue about her son. As you enter the room, you see Senator Perez put a white and orange pill in her mouth and follow it with water. Ah, just the person I wanted to see, she says. I've been here for over 4 hours. If our government worked like your hospital, well, we'd never get anything done. When you ask her what the pill is, she says, it's one of my prescriptions. Look, when will I be able to get out of here? You don't know? Great. She pulls out her phone and dials. She waits, then hangs up. That's her son. None of my family's picking up. This is just one shit day. She rubs her temples and says, God, this headache. Then she looks up. Well, I hope you at least have good news for me. Yikes. Okay, I think this is going to be her son. I'm not sure how that helps us, though. And I'm not sure what we can do for her. There's very little else. She's still got a headache. I don't love that. She could have something else beside the blood aneurysm, but seems unlikely. But we could see if her kidneys are acting up again. I don't know. Let's just put her on the side. She's fine. All right, now let's give this guy his fluids, CGW, and then we'll decide what to do. But if he's the son, he's probably got kidney disease, so we gotta be careful about that. CGW. Story card 62. To avoid the festering wound you find on his right arm, you insert an oh, he's got a festering wound on his arm. To avoid the festering wound, maybe he needs antibiotics. To avoid the festering wound you find on his right arm, you insert an IV catheter into his left arm. As you do, you look carefully for any track marks or bruising that would indicate he's been taking drugs via a needle. His arms are clear. Either he hasn't been using drugs for very long or he isn't taking them intravenously. You attach the fluid bag. As it drains, you can see John Doe perk up. He was clearly dehydrated. Okay, and then we got these two symbols. Now let's go back to our instructions here. What is this saying? Before each action, check if you've revealed 4 or more. Before each action. So I think we just got the 4 or more that we need here. I think we now have 4 of these. 1, 2, 3, 4. So I think now we've triggered this event. God help us. Okay, so does it need to be 4 different? It doesn't say it needs to be 4 different. How do we know? What makes you say that? We've got 4, but it doesn't say check if you've revealed 4 or more different ones. You guys are just making that assumption, but based on what? Look for cards. We have 4 cards with those symbols. But then it says, before each action, check if you have revealed 4 or more of them. Ambiguous. It's very ambiguous. 4 or more than the symbols. No. Boy, that is just completely ambiguous, but I don't see how you're assuming it's one of the others. If it were, I think if one has to make a guess, check if you've revealed 4 or more of them. Look for cards with these symbols, 4 or more. Okay, it doesn't say different. I'm going to say that we have revealed 4 of them. I don't think there's any way to know, but hopefully it won't make much of a difference. If it wanted to mean different, it should have said it. The nurse monitoring the John Doe calls you back in. His breathing is labored. Really? His face is locked in a constant grimace of pain. Despite what you've already done for him, this has been a difficult day for the John Doe. He's in terrible shape. You're not sure how he keeps going. He's also been through a lot of stress over the past hours. Suddenly, he arches his back and cries out. Look through all the cards you've revealed, including the centers. Find cards with a X heart and a plus. If you have more X heart than plus, take story card. All right, let's see what we got. Pluses and hearts. Plus, plus, heart. Heart. Okay. I'm starting to get really annoyed with this kid, to be totally honest. If you have more crossed hearts than pluses. Okay, we have 3 pluses. The pluses are us trying to treat him, and the hearts are bad things happening to him. So we don't have more X's than plus. So story card 80. Should we have triggered this yet? We don't know, but I think so. The young man must have a strong will to live. However, it's still not clear whether he's going to survive the night. Something is causing him pain, and it isn't clear what it is. Take story card 82 and then 61. 82 and 61. I mean, yeah, we want to scan him for some back injury, but we can't get him stable enough. Here's 82. The John Doe grits his teeth and pushes through the pain, which seems to let up after a few minutes. He's stable for now. That's interesting. You may continue to work with either patient when you're ready to fill out your final report, but before you begin, see when you are ready to fill out your final report, but before you begin, see LTP. When you're ready, you can complete your final report for both Senator Perez and the John Doe. Okay, so basically he's good enough. We've got him through the day. He pushes through the pain, which seems to let up after a few minutes. Okay, so actually the worst is over, thank God. But we still have time. Obviously, we are going to spend that time to solve what's going on. All right, so something is still going on. Something is causing him pain. It's not clear what it is. Okay, so I think we can take a little bit of a breather here for a second. We've got two patients. One is a pill-popping senator, and one is this kid who's got something causing his pain, but he has stabilized. It does seem like he might have an infection on his arm. Where is that comment about his arm? Festering wound on his right arm that he keeps rubbing. Okay, so for that, probably we should test if he needs antibiotics. Where is our guy? And why are we not told to get a new status card? He's clearly not in... He's clearly not in that severe pain anymore. So why isn't the game giving us a new status card? I feel like this case is a little less tested, proofread, tuned up than the others. He's stable, but this says he's in extreme pain. All right. So I think it's probably not his back. I wonder if the nephrologist would be able to look at his arm. Where's our experts? Kidney specialist. Oh, okay. So if we think it's kidney. Okay, well, we could do chem test 7 on him to check out his kidneys. But I'm very curious about this infection of festering wound. Clearly that needs antibiotics, right? Would a CBC tell us what antibiotics to give him, though? Complete blood test uncovers conditions anemia, infection, and leukemia. Okay, I think we do a CBC on him. Figure out that he's got an infection that we treat with antibiotics. Don't you think? Would a CBC tell us which antibiotic to give him? Let's just look up these antibiotics because maybe we're going to need to test his kidneys first. Amoxicillin or ciprofloxacin. Amoxicillin is certain bacterial infections, will not work on viral infections, and ciprofloxacin, bacterial, can cause adverse side effects including diarrhea, vomiting, nausea. Patient has ever had seizures, epilepsy, or arteriosclerosis, or kidney disease. Okay, we need to do a kidney disease first, because if he's got a kidney problem, then we need to choose our I think we're going to do a CBC and we're going to do a Chem 7. Doesn't feel like the bacterial infection would be causing him pain, so that might be kidney. But also spine, MRI, Chem 7. It looks to me like we're going to do 3 tests. Bang, 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 and then treat. So I don't know if he's going to sit through an MRI in the spine. I really don't know if he's going to sit through that. But let's do a Chem 7. If he doesn't have kidney damage, then we can just move on. He's pushing through the pain. Okay, I'm going to do a Chem 7. We're in the 1600 time. Chem 7, 1600 is DZC. And the reason we're doing this is we think they may be related and he may show he's got kidney disease. DZC. You guys should speak up when you see CSX. If you've revealed a card with this, then CMCL. Have we? Yes. Okay. MCL. The test results show creatine has EGFR of 35 and all other values are normal. Discard 76 if you've revealed it. EGFR 35 creatine. Discard. Card 76. The hell is that all about? Okay, we don't have a 76. Do we? No. Okay, we haven't drawn 76. We've heard about creatine mentioned. It doesn't tell us whether it's elevated or not. What is... It's not under drugs. And it's not under vitamins and supplements, but we have seen it mentioned before. Where have we seen it mentioned before? In the blood, a waste product arising from normal wear on muscles. Increased levels indicate poor kidney function or even kidney failure. Can be used to calculate estimated glomerular filtration rate. So it just told us what it is. I think that means that if we talked to the specialist, he might be able to interpret that. want to make sure we have time for everything. Any thoughts? Okay. Look, imagine you're me. Imagine you're me and you write and you read this. Okay, you're reading. Okay, here we go. That's slight to moderate kidney damage due to chronic disease, according to the internet. Melissa says Chem 7's okay. A CBC would show increased white blood cells for infection. You had one. I want x-rays. Then Melissa says GFR is 35 is low. Larger than 60 is normal. Misty says creatine is kidney related. Debbie says good thing we didn't give him the ibuprofen. X-rays next. Imagine you're me reading that. You can see why I'm more confused than before I read all that. All right, so we've got kidney results that seem to suggest a problem with the kidneys. Not quite sure if we're supposed to treat that, though. We could talk to the kidney expert. He might give us some insight on what this means. We're worried he may also have back injury and infection. But I don't know if it's a viral infection or a bacterial infection. So I think I have to do a CBC. Let me just read what the lumbar test is supposed to figure out again. Cancer of the spine or other injuries. No. Okay, so I think I have to do a CBC to find out if he's got a viral or bacterial infection. I think we're going to need to do X-ray or spine. I don't know. It seems like the chat had a preference for X-rays, but no explanation for why. We know he's got an infection that I want to treat with antibiotics, but I don't know which one. I'm going to do a CBC on him. So we're still in the 1600. CBC is UQU. UQU. PCH. His white blood cell count is elevated. Really? That's all I'm told? Really? We've done a blood test and all I'm told is his white blood cell count is elevated? Really? Really? This was supposed to do this. Help the body fight infection and disease. High WC, which is what we have, usually indicates body's fighting an infection. Well, that's great. We already knew he had an infection. I'm just trying to figure out what kind it is so that I can know what antibiotics to give him. That is some bullshit. Ciprofloxacin or amoxicillin. Let's look at those again. Avoid if they have kidney disease, so we're not giving him that. Amoxicillin, bacterial. All right, I guess I'm just going to give him this. Nelson says, just give him amoxicillin. That's what doctors do. Boy, that was a very wasteful test, but I guess that's realistic. Sometimes you give him tests. Infected cuts. Okay, maybe I should have seen that. So I'm just going to give him that antibiotic right now. You could argue that he's got bigger problems. Like possible back injury. Maybe we should do that first. Okay, so if we know we're going to give him this, let's delay it for a second and talk about an x-ray. All right. So let's have a talk here. Please try to give full concepts, full statements. We are going to give him the antibiotic, but that may not be the biggest concern right now. I guess we're concerned that he has kidney problem or back injury. So Nelson says, MRI is spine only. We want a general overview first. Yeah, except this doesn't say general x-ray overview. It says chest and abdomen. Maybe he is a drug mule. Maybe he is a drug mule. He doesn't have IV. He's in pain. He may not be a regular drug user. He's checking his phone. What if he is a drug mule? It's a little unrealistic because if he's a U.S. citizen, then you don't drug smuggle narcotics in your stomach if you're a regular citizen. That's just for people internationally flying. Okay, but I guess that's our concern. All right, let's do an x-ray of his chest and abdomen. $1,600 is RJK. I guess we're a little bit suspicious of this, and if his stomach is filled with drugs, then we're going to do surgery on him and get it out. So I guess this is our worst case scenario here. RJK. It doesn't really make sense for it to me, but maybe he was overseas with his mother. Okay, it doesn't quite make sense, but it is a fun idea. RJK. DMAZ. The x-ray shows nothing of note. Neither his spine nor his ribs are broken or cracked. There doesn't seem to be any evidence of a kidney stone either. Neither his spine nor his ribs are broken or cracked. Okay. Well, that's interesting. What if he's got a bacterial infection and it's meningitis? What if he's got an infection of his spine from the bacteria? Let's look up meningitis. It's not something that happens often, but it is rather serious. Where's our meningitis? I think it might not be in brain, but in meningitis, bacterial, caused by a bacterial infection of the upper respiratory, travels through the blood to the brain. Treat immediately with antibiotics to reduce the brain swelling. It's not really having that, but this is what fungal infection, viral meningitis. We don't think it's viral. What I'm worried about is if he's got like viral meningitis, inflammation membrane surrounding the brain and spinal cord, often caused by infections. Fever, headache, stiff neck, sometimes a rash. Lumbar puncture can determine the cause and guide treatment. Doesn't really sound like that, does it? All right, well, we want to give him the antibiotics, and if he does have meningitis, the antibiotics can't hurt and might help. So we are going to give it to him. We haven't asked any of them questions, but amoxicillin. WFV. This is our last action before the update. WFV. We've left the senator alone. Hopefully that's not going to come back to bite us. WFV. Story card 79. There's no immediate effect. It will take some time for the medicine to take effect. All right, it's time for this update. We'll take our break first. We'll come back. We'll read the update. We are back at the 75% progress state here of Medical Mysteries Patients 3 and 4, the most stressful case we've played so far. Lots of ideas from the chat. How many actions do we have left? Maybe we should talk to the kidney specialist. Should we ask the center about her pills? Plus there's overtime. Read the Chem 7 card again. It just told us the actual creatine. I think the nephrologist, the kidney specialist, is going to be the person that would interpret the Chem 7 results. This is one of the craziest one-stop shop places I've ever seen, says Melissa. Okay, well, before we can make any decisions, we have triggered the update. So let's see if this, I'm afraid the senator is going to walk out of the office and not let us ask her any more questions. I do think we could also try to find out if these two were related by asking this guy some questions, but let's do our updates. So it's 1800. Let's do the senator first. Her 1800 is JLR. Let's just hope her status doesn't change. JLR. Story card 28. She probably wants to get out of here, is what I'm guessing. Before you can check on Senator Perez, the hospital director pulls you aside. You know what's happening with the senator? She's given me quite an earful about how substandard her care has been. You start to explain, but the director holds up her hand. I know we're understaffed today. It's just that the senator knows several of our trustees. Has made it perfectly clear she's going to talk to them. The director sighs. Look, I've got your back. Just do your best not to piss her off any further. From inside the room, you can see Senator Perez smirk at you as she takes an orange and white pill. Oh my God, she's just popping these pills. Are these her ADHD pills? I mean, we just don't want to piss her off, but we could ask her about the drugs she's taking. What drugs are you taking? I do think we need to talk to her about that, but let's do the update for this kid. I hope he's not going to be in as much pain. MSE. If you have revealed a card with the antibiotic, we have YGY. Okay. Here we go. Now is our benefit for having given him the antibiotics. The John Doe is still in a great deal of pain. He keeps holding his back. Will you let me contact your mother, you ask? He shakes his head. What about your father? He laughs. My dad'll just tell my mom. He crosses his arms. I've got to solve this myself. He scowls and says, really, I'm not a drug addict. I don't use needles. Then he stops talking, his eyes squeeze tight as he breathes through the pain. Okay. So he is still in a lot of pain. He's clearly trying to self-medicate his pain away. We have done an x-ray and seen no cracks in his spine, but an MRI of his spine might give us more information. A nephrologist would tell us about his kidney problems. I guess I'm inclined to do the MRI of the spine and the nephrologist. The other thing is, what does he wants to handle it himself, huh? He won't let us talk to his parents. He won't tell us doesn't seem like he wants to tell us his name. I don't think he's going to be much help. All right, we're going to start by talking to the nephrologist, but I think we may need to talk to the MRI. We may need to do an MRI of the spine. I guess the idea is the CT showed no cracks, but what would an MRI show us? Well suited to capture images of non-bony parts are soft tissues, nerves, ligaments, and tendons. So I think what we could find is that although he doesn't have a cracked spinal thing, he may have a muscle problem. But we can start with the nephrologist. We only have 5 more actions left. We want to ask her some questions. All right, ZAM nephrologist. Let's start there. Hopefully this guy can give us some advice. If you've revealed card with this, I don't think we've seen that symbol. That, what would that be even? That looks like it's some sort of test we could have performed on his kidneys. I don't think we have that. It's unfortunate. Feels like it would get some information. Otherwise, BMV. I feel like we've done all the tests. Oh, I wonder if we haven't done a lumbar puncture. All right, well, I guess that's... Let's try to metagame it too much. BMV. Let's see, maybe he'll advise us. BMV? BMV. BMV. The nephrologist says, from the tests and exams you've done, I see nothing about his kidneys to be concerned about. Perhaps a Chem 7 lab will reveal something. Yeah, we did a Chem 7. How about you look at the results of the Chem 7? DZC. Let me look up the Chem 7 again. DZC. What kind of bullshit is that? What a waste that expert was. CSX was MCL. Creatine 35. All other values are normal. What bullshit. The Chem 7 test did not get us anything. Did not get us any cards. I can't believe that goddamn nephrologist was so useful. Useless. MCL. All it says is creatine. All other values normal. And then we talked to the nephrologist and we're like, okay, what do you think? He's like, hey, maybe you should do a Chem 7 test. Yeah, we did a Chem 7. We thought you would be able to interpret it for us. Glomerular filtration rate. That's it? How about some insight into what that means? How useless was that guy? CBC will show high WBC, which we did see. Treat with antibiotics. So this could cause pain. It all could be a kidney problem that we've already treated with the antibiotics. What a useless expert. What a useless expert. Well, what have we got? Boy, that was a waste. What is the lumbar puncture? What would that get us again? I think we looked at that and decided there was no point in doing it, but for some reason it isn't on here at the test. Okay. Lumbar puncture to detect meningitis, leukemia, cancer of the spine or brain, or other illnesses. I wonder if we should do a lumbar puncture if we do think it's meningitis. cancer of the spine or brain, that would be something you would self-medicate, maybe. I did think it might be meningitis. Should we try an MRI or should we try the lumbar puncture? I think I'm more inclined to want to do a lumbar puncture. I mean, if he's got some, if he doesn't have spinal damage, then whatever we MRI, we're not going to be able to treat. But a lumbar puncture, if we think it's, you know what, we're going to have to do a lumbar puncture because spinal meningitis, which I had when I was a little baby, that can kill that kills people. And I think there's our worst case. The MRI is not going to give us a worst case. It's not going to save us from worst case scenario. All right, I'm doing a lumbar puncture. I worry he's got meningitis from an infection, and if he's got meningitis, it's serious. Whereas we've already x-rayed him. We know he doesn't have any broken, we know something got damaged with his spine. So if he's got some other degenerative thing, it's not an emergency, but meningitis would be an emergency. So lumbar puncture. And the other thing is, like, meningitis back, like, that could cause crippling pain of him bending over. I don't know if he's going to tolerate a lumbar puncture very well, but I definitely think this is possible here, that he's got meningitis. Let's see. PDZ, story card 72. Here we go. This could break this case wide open or leave us mystified. This card is going to determine whether we graduate med school or not. John Doe is not happy about your proposal to perform a lumbar puncture, but he consents. You have him lie on his stomach and you insert the needle into his back. You carefully draw a sample of fluid from his spinal cord and send it for analysis. Soon the results are available. His fluid's normal. You share the news with him. Why did you make me do that? It was painful and uncomfortable and pointless. You explain it rules out spinal or brain cancer, but he doesn't seem to be listening. Okay, he's not happy, and I am getting kicked out of med school. That's going to reduce our score. Well, no, that's our girl. What is causing his pain? What is there left to do? We could do a drug panel. We could do an MRI on his spine. I think it's time for the MRI on the spine. He must have some degenerative tissue problem. We did the comprehensive blood test. It gave us nothing. It just said his white blood cells were up. All right, I'm doing an MRI on his spine. I don't know what else to do. KGW. FYE. Okay, I'm being alerted by the chat. What is CBC? Check Jesse. It should be the last one. I don't know what that means. What does that mean? Check Jesse. It should be the last one. I don't know what that means. KGW. All right, let me pause. Nelson has usually got something to tell me, but I don't. I'm going to pause and not look up this thing. I don't know what this means. It should be the last one. We should take the fourth code, not the third. Don't know what that means. You're saying here, when we did this MRI on the spine, we're in the 1800 period. You're saying we should be here. MRI of the spine and the 1800 hours. Okay. VYU, not KGW. Okay, it's good I stopped. VYU. Okay, these people have got me on tilt. I'm ready to quit the hospital. VYU FYE, same result. The MRI technician asks, would you like me to use gadolinium contrast? If yes, if no. Or you can choose not to do it at all. I mean, that's an interesting question. This nephrologist has not been very helpful to us, but he's made me nervous about giving this guy any contrast dye. The woman is allergic to iodine. This guy, we don't know at all. Or we could change our mind about doing the MRI. Did we check the Chem 7 result code again? Have we missed a card? Chem 7. We're in the middle of the MRI, but we're backing up. 1600 was our was our Chem 7, which was DZC. DZC says CCSX. CSX says if you have this card, which we did, then we see MCL. The test results show creatine has an EGFR of 35. All other values are normal. Discard story card 76. Well, okay, so this EGFR is of no use to us. It feels like someone should be able to explain what that means. Somehow it's not in the books, and when we talked to the kidney specialist, he had no insight onto it. So, like, that feels like a real mistake in the game. It's telling us a number for his EGFR. And we have no way to make any sense of that. You could look it up on the internet, but that clearly seems like it's something that the game doesn't normally expect you to do. It seems very strange that the expert couldn't interpret that for us. All right, now we're back to our MRI question. Somehow the kidney expert was the worst, most useless person. And now all of a sudden this game wants us to do internet searches. From the internet, galodinium is less likely to cause allergic reactions. Well, that's not all that reassuring to me. Can we look up galodinium? No, I don't think we can. No, I don't think we can. I mean, we can try, but I don't think it's in there, but we'll look. Here's the MRI. Soft parts of the body. And then if you try to look up galodinium in the drug, I guess. Oh, here it is. Used in MRI contrast to improve image quality. Can lead to kidney failure. Whoa. Okay, so it's good we looked that up, but how are we supposed to interpret this? We were told his EGFR was 35. So how do you read this? Like, should you look at this and say, oh, he's 35, so he's fine? We can do this? Or you should look at that and say, oh my God, that is so close to being deadly that, of course, don't use it. Couldn't you use one little line in the textbook, like not recommended? Like this is like, it's going to lead to kidney failure in this condition. Well, how about if it's a little bit higher? Obviously, I'm not going to do it. 35 versus 30, I assume that's a small difference, but I need some guidance. Look at this. Look at this insanity. 35 is over 30, so probably won't lead to kidney failure. Yeah, it's not going to lead to kidney failure, but does that mean it's safe? We don't even know. We don't even have a good reason to be doing an MRI on this guy. Why give us a specific number if we're not going to use it? That's a great question. Well, a better question would be, why give us a number that's so ambiguously explained? Kidney failure if it's under 30. Sure, okay, so now we know it's not going to cause an outright kidney failure, but sure doesn't seem like it's a smart thing to do. On the other hand, we don't know. Maybe the scale is 35 means your kidneys are amazing. We don't even have a good reason why we're doing an MRI of the spine. Just doing a million things on this guy. What if we did a drug panel and found what? What would we find? What drugs he was taking, but how would that... I guess it could tell us, like, he's taking some... Could be taking his mother's drugs. Could be the MRI is the only way to find the real issue with his back, but I'm with Melissa and thinking there's a mistake with the nephrologist's result. What does that mean, there's a mistake with the nephrologist's result? The nephrologist just gave us his opinion, so I'm not sure what you're talking about. Are you saying we read the wrong thing? Are you saying it's the Chem 7 test that's an error? Are you saying it's something that the nephrologist said is a bug in the game, or he's wrong? I have no idea what you're talking about. I'm ready to send this kid into jail. I'm ready to just let him die. And Nelson is back on trying to metagame this whole thing. Let's not try to metagame it too much. His back's in pain. We thought it was kidney. We tried our best to find some kidney-related thing. We've got a toxicologist, too. What would the toxicologist help us answer? Expert in drugs and toxins. Drug panel would tell us what? Commonly used street drugs. I don't see how that helps us. What are we thinking that this MRI is going to show us? Non-bony parts, soft tissues of the body, nerves, ligaments, and tendons. Do we want to leave time to talk to her? Is there anything we could ask him that could give us insight? Should we ask him what drugs he took? What happened? Should we pause and have a question? Yeah, shall we? We could either, we haven't done this MRI spine. It asks us if we want to give him this contrast dye. So we either have to finish off with the MRI or we could abort it and do something else, like ask him some questions. All right, I'm gonna pause the MRI scan. Maybe we'll go back to it. Let's ask him questions instead. Kidneys are working at 30%. That should have been addressed by the kidney specialist. I really think so. Is it possible that look, we haven't found a single bug in this game. So we could read the nephrologist again and see if we somehow overlooked something. ZAM was the nephrologist. ZAM. If you have revealed a card with this mystery symbol, which we've never seen, otherwise BMB. Feels like we should have found that symbol, but we didn't. BMB. And the nephrologist said, nothing to be concerned about. Perhaps a Chem 7. It sounds like this should be the Chem 7 result. I'm going to just peek at this, WNF. It sounds like it's suggesting a Chem 7, but we've done the Chem 7. Let me just look to see if WNF talks about... I see you run. Okay, so this looks like a bug. I see you run the Chem 7. These high numbers indicate a kidney issue. The most likely cause is dehydration. Weird. Giving him IV fluids. Was that a symbol on our IV? That was very weird. We did the Chem 7, and it seemed to think we should have a symbol for that. All right, so maybe we just confused it. Okay, so he says kidney issue, give him an IV, but he doesn't help us in any other way about treating a more serious kidney issue. All right, well, let's do an MRI, but we're not going to use any dye, I guess. VYU. I'm going back to the MRI. VYU. MRI. VYU is story card 27. What's happening here? MRI of the spine. VYU. Why is it not asking the contrast dye? Was that on a... Is that because I'm looking up at her? BYU story card 27. I'm confused. I'm confused. All right, let me pause here. I don't know what's gone wrong. Something has happened. That's a mistake in me or something. MRI spine. MRI spine. VYU. So I look up VYU. Maybe I was looking up in the wrong second. Oh, here it is. VYU, FYE. I was just reading the one above it. Okay. FYE. Okay, this is the part about asking us what dye. I'm getting on tilt. I can see it. Would you like to use gallidium? So here's the thing where we looked up. We know you shouldn't use gallidium with less than 30. He's got 35. But it doesn't say you shouldn't use it with less than 30. It says if they have the creatine less than 30, you're going to totally destroy the kidneys. And then it's just kind of like, oh, what about 35, a little bit more? And the book is just no help. All right. Well, I wouldn't take a chance if I was just, if for some reason someone with no training and no access to more information had just these facts, surely I would just say, don't risk it. So I guess we're going to do MVE, and we're just going to get a bad MRI. Okay, I'm just going to do it. I'm on tilt. But we're now having to try, this is the second time we're trying to play a game on this, about trying to think what from a game perspective would be the reason it would say kidney death at 30, but you have 35. I can't do it. I can't do it, guys. That's just too gamey. I'm frustrated. I think it's a bad design, but I'm not going to use the die. But there's no information here about, is it useless to run this without die? This is the second time we've canceled this MRI. Boy, this is just, I'm fully on tilt with this game now. But it's mostly not mad at the game. It's mostly just mad at the stressful situation. All right, I'm going to ask him questions, but I'm not sure. I'd like to know, how can I help? Why are you bruised? What drugs did you take? All right, I got to talk to this kid. I'm too on tilt here. So I'm going to interview him. I'm going to start by asking what happened. Why are you bruised? May I see your arm? I already seen his arm. Okay. Questions. I'm going to start by asking him GMW to tell us what happened. This is frustrating. Story card 55. I was stupid. I took a walk in a bad part of town. I got jumped and roughed up, had my wallet stolen. They didn't find my phone. Who gave you Narcan? I don't know. I was with someone. Maybe he did. They really worked me over. He touches his face and grimaces. Then he rubs his arm and back. Show me your arm. We don't care about your arm. We've already seen it. I'm going to ask him what he needs, which is, how can I help? What do you need? Because we don't know. Maybe you know what's wrong with you. Maybe you know what's wrong with you because we can't figure it out. CJA, story card 56. Are you for real? You've obviously been through a lot. It sounds like things might not be so good at home. Yeah, it sucks. I wait for him to finish, but he doesn't. You don't have to, you say, you don't have to do all this on your own. There are people who can help. That's a nice offer. When my mom finds out, she doesn't have to find out. I'll think about it. Useless, but gives us 2 of these. I guess that puts him in a better mood. But as far as us figuring out what's happened, totally useless. Okay. I'm done with this kid, I think. I think maybe he had a infection from and that the antibiotics are going to fix it. And if he dies, I don't care anymore. Now, let's see if we want to finish up her story. We've got 2 more actions or overtime. Let's talk to her and find out what drugs she's taking. Maybe we can get her on the good path in life. This was with the John Doe. Okay, let's ask her what drugs she's taking. WLP. Maybe we can help her stop taking drugs. This kid is a lost cause. Story card 3. We've got a whole deck of cards with her we've never seen. I don't use drugs. I take pharmaceutical medication prescribed by my physician. I take a couple pills in the morning and a spray for my allergies. I also take something for my ADHD. Here it is. Okay, well, there's her orange pills. We knew all about her ADHD. We already figured out she's abusing them, so that was of no help. Now what? Now what? These are all useless to us. I mean, who cares if she's had symptoms? We've already treated her. She's already taken care of. I'm going to ask this guy a second question. I'm done with her. GMW. I'm going to spend her second question on him. And ask him. Well, I already asked him what happened, didn't I? What drugs did you take? I'm going to ask him what drugs he took. XLW. Maybe it's going to turn out he took. You know what? I bet he took like Vicodin or something, and it's upset his kidneys. XLW. Story card 54. This isn't strictly legal, but it's legal enough. I didn't take any drugs. It would help us treat you if you told us what you took. We won't report you. I didn't do anything illegal. Your life may be at risk. Yeah, especially if my mother finds out. Okay, so totally useless. All right. Well, we've got 1 time slot left, and then we could go into overtime if we wanted to. But, all right, let's go ahead and do the drug panel on him. He won't say what drugs he's taken. Do you want to do the MRI or the blood or the drug panel? Clearly taking drugs. All right, we're going to do the MRI, which I keep trying to do and keep chickening out, I guess. It was FYE. Okay, what does the channel want to do? You want to give him the contrast dye even though he could survive it? UKU. We're going to give him the contrast dye. If he dies, I'll live with it. Seems very poorly designed. If you've revealed a card with the blood, which we have somewhere. Surely. Okay, here we go. There it is. VMX. The MRI scan is clear and highly detailed. From what you can see, there's no indication of a spinal epidural abscess. Okay, he's fine. He's got nothing wrong with him. All right, let's do our tests. The dye didn't hurt it, didn't seem to hurt him. All right, let's do the updates for these two. And let's get out of here and go home. ABR. You can't believe it's the end of your shift. Finally, Senator Perez will be someone else's problem. DHR. If you revealed a card with a blank, with this, I mean, surely we've got a lot of those, right? EFA. The end of your shift, you'd like to continue with overtime actions, you may do so. Take story card 61 if you haven't already. Okay, well, we have already taken 61. 61 is probably the card where he's like in a bad mood, but we haven't figured it out. He's in extreme pain. So anything we do now, we're doing in overtime. We've done just about everything on this kid. The only thing we haven't done is a drug panel and seen the toxicologist. So I guess we're going to go and do those two things in overtime, which just seems crazy to me that... So, drug test. Feels like we've overlooked something or something. BWC, or we're done. Or the antibiotic is going to cure everything. BWC. It's just very bizarre that he's in extreme pain and there's nothing else. And we can't seem to get a hold of anything else. BWC-NUP. The result of the test is positive. Primary metabolite is 6-NAM morphine. This means he's used either morphine or heroin. You can't tell which. Okay, totally useless. as we suspected it would be. It's just an opioid. I guess I'm doing the toxicologist. Well, I guess we're doing everything on this page. Feels like something has gone wrong, but here we go. You consult with the toxicologist about the John Doe. He's lucky Narcan he was given may have saved his life. I've seen a disturbing number of cases where street drugs have been laced with fentanyl. As you've seen yourself, when Narcan wears off, it can lead to a rebound. Fentanyl's a nasty drug. Fortunately, it'll be out of his system soon. I'd avoid all opiates until he's recovered. So that's it. We've done it all now, except giving him more painkillers that will kill him. Unless something's gone wrong that we were supposed to read. I'm just going to peek at his other status cards. Oh, he may not have any more status cards, so he may never get leave. He never gets better than in extreme pain. I think the back pain was the infection, so I think that's it. All right, let's read LTP. Find the two cards with this and this. If you need another hint, see XMA. Okay, let's see. Okay, so these two are gonna. This is how they're gonna be related. Probably they're. Oh, look. Look at that. Look at that. Look at that. Look at that. Look what it's supposed to do. We were looking at this and saying, what does that mean? But now I see that we're going to find out if they're bringing them down the hallway. So we did figure out they were son and daughter, but this is interesting. Okay, let's take card 67. Nurse Judy's sitting with the John Doe and finally convinced him to call his mother. As he makes the call, you hear a jingling ring tone down the hall. No answer. Sometimes she's busy. She told me to call twice. He calls again, and the jingling sounds again. That's the ringtone my mom uses for me. He rolls out of bed. Before you can stop him, he's down the hall. Mom? Mom? Take story card 87. Senator Perez says, it's about time you... Wait, what are you doing here, Joe? And I thought I told you not to dye your hair. He says, Mom, are you okay? She says, no, I'm not. Hopefully I will be. Suddenly he bends over in pain. She says, what's wrong with him? Grimacing, he tells her everything. You watch as the senator's face drops in horror as he talks. When he's done, she says, you're the drug addict? She gets out of bed and puts her arms around him, and for the first time you see her let go of being a senator so she can be a mother hugging her son. Senator Perez is the John Doe's mother. You feel a mix of emotions at discovering this. Dealing with him as a John Doe created a lot of difficulties for you in diagnosing and treating his condition. It's like working in the dark. Who knows what his medical record might have revealed? If only you have an intuition, you're missing something. If you have an insight, write it down on the patient form. When you're ready, take story card 85. Okay, so we're supposed to write it down and then reveal. So I have a theory. I have one theory, but I'd like to hear your theory. The chat says the insight is probably that he has polycystic kidney disease like his mother. Yeah, I guess that was our theory too, originally. Yes, it does say it's genetic. It doesn't seem like a big insight, though. I mean, we've been discussing it for the whole time. So how do we know we're missing something? But yes, I guess that would be the thing. I'm going to put down that his symptoms are partly caused by the kidney disease, but what I was actually thinking is that could he says he's trying to do this himself. Like, I wonder if he's trying to get off drug, if he's trying to take some anti-opioid stuff himself. Or Fox Screen said morphine or heroin, didn't mention any of our meds, so he might have OD'd on. Yeah, you guys you're going off the track here. She doesn't have any morphine. I'm just trying to think if there's he kept saying he's not a drug user, he's afraid we'll tell the cops. Like, is there something? I was trying to think, like, is he doing this just to get her attention? Is it possible that he took the morphine and the Narcan to get her attention, made his own call? But I think he's got an infection from his arm. He went to the bad part of town. And he's clearly lying. He doesn't want us to call the cops, and he doesn't want his mother to know. So I guess there is nothing deeper. She doesn't have morphine. She doesn't have any of that. So I guess it just wants us to figure out that he's got kidney disease. I just don't know why it wouldn't let us diagnose that. All right, I'm just writing down that it was the kidney disease, but we'll see. I mean, sorry, I shouldn't go on. I should pause. If anyone else has other ideas for what the intuition that we're missing is, you can get it out now. You should state it now. This is the question you're answering. This is the only question you're answering. If you have a guess about this that is different from the genetic kidney disease, say it now in the chat so you can get credit. Otherwise, I'm guessing it's the polycystic genetic disease, kidney disease, which we were sure he had, but we could not find any way to test for it. Melissa says it's the kidney disease. Misty says it's just the kidney connection. All right. So story card 85. Let's see if we're right. Carmen Perez is Joe's mother. You recall that her medical chart says she has polycystic kidney disease. That's a dominant genetic disease, meaning there's a 50% chance that Joe has inherited it. If he does, such cysts would be the source of his pain. A kidney ultrasound would answer that question immediately. Well, yeah, if we had been able to do that, we surely would have done it. I guess we weren't supposed to be able to do it. If you have revealed a card with this, we don't even know what that is. Overdosed, rebounded. Let me just look at his status card. So we didn't ever have a chance to do that test. No, we couldn't have done it, but I don't know what this is about. Okay, otherwise 58. Okay, so we're taking card 58. You waste no time sending Joe for a renal ultrasound. The results are conclusive. He has several large cysts on his kidneys. No wonder he's in such pain. The nephrologist advises immediate surgery and rushes off to prep to perform the operation herself. And then we're going to recommend she get fired from the hospital. Looks like Joe will survive the night. Take card 65 if you haven't already. Boy, we're going to be looking behind the scenes at these cards when we're done. It's time to complete their final report for both Senator Perez and John Doe. What was the cause of each of their symptoms? What treatments did they require? What recommendations do you have? Okay. Well, let's go ahead and write our report here. I'm a little bit on tilt, but we have reached the end, so let's just push on through here. So Senator Perez had an aneurysm. We'll write this out, then we'll take a break, then we'll come back and see if we've missed anything. Aneurysm and maybe amphetamine abuse. And John Doe OD'd on morphine and heroin, or heroin, whatever, or derived. And that's what's causing his pain, but he also had an infection in his arm. What treatments did we do for her? We gave her surgery. That's basically it. And for John Doe, well, I guess we gave him acetaminophen after we overdosed him on Narcan. Narcan plus oxycodone, which he didn't respond well to. And then the game didn't let us treat his kidney stuff. Stop the amphetamines. Stop the opiates. Seek kidney treatment with a different nephrologist, not the one at the hospital. And talk to your mom. Take vacation with your son. All right, anything else we're missing here? I guess we gave him antibiotics. Anything else? Counseling? She can just stop taking the amphetamines. Just deal with your ADHD. All right, we're going to take a break. We're going to come back. We'll read the epilogue. If you have things to add, you can think about it over the break. Otherwise, we'll come back, we'll read the epilogue, and then we'll look behind the scenes at the cards we didn't see, try to make sense of it. Debbie says, hey, let's remember legal stuff. Is there anything to report legally? Ironically, in this one case where we've thought about it, I don't think there is, but I guess we could check. Where's our legal? I want that nephrologist fired. Legal is in this booklet. Health insurance portability, infections, certain infections, public health laws, release of records to parents concerning the treatment of minor sexually transmitted diseases, drug-related, don't arrest them, child protection abuse. No. Okay. Let us take our break. When we come back, we'll read the epilogue. We'll look at the cards we didn't see. We'll try to understand if anything went wrong. And we'll discuss our thoughts on this double length, double difficulty case. I'll see you in 8 minutes. All right, well, we've been playing for 6 hours now. Not that unusual for a night stream, but pretty unusual for a daytime stream. And this is a game that's full of stress, and it did show. I think we saw some of the stress come out. A very odd case. The channel has given a bunch of thoughts, but we're going to read our epilogue first before I read your comments in the chat, but we will. Okay, anything to add here on our final causes, recommendations, etc.? If not, we will read our final solutions. The rules say, what was the cause of each of their symptoms? What treatments did they require? What recommendations? Okay, both epilogues starting with the senator. Painkiller for the senator's surgery recovery. She doesn't seem to need painkiller, but maybe for this guy, we should tell him no pain killers, bad for kidney. Like, he needs to start now making sure he doesn't take certain painkillers. You want to prescribe her some painkiller, mild painkiller. I think acetaminophen. Okay, let's read her epilogue here. Then we'll get our score, I guess. Paracetamol for both, says Nelson. Caring for the center has been challenging, to say the least. She's confident she has a heart issue, while at the same time she believes there's nothing wrong with her blood pressure. Simple EKG or troponin lab will show she's in no danger of having a heart attack. Her blood pressure, however, is something to be concerned about. If you run a Chem 7, you'll find that her creatine and potassium levels are elevated. You might believe her polycystic kidney disease is at fault. Kidney ultrasound will show she does have cysts, but they're not an immediate concern. Several of the medications she's taking can cause headaches or make breathing difficult. If you run a drug panel, you'll find she has amphetamine in her system. However, this shouldn't be surprising because she takes lisdexafemitine for her ADHD. In fact, she takes quite a bit more lisdexafemitine than she has been prescribed, as can be seen by the orange and white pills she keeps taking. You could discover what these pills are by asking her a question about her prescription, so it's not surprising she's having an anxiety or panic attack. You can calm her down with lorazepam. However, you still have to deal with her high blood pressure that the lisdexafemitine and anxiety have caused. Labetalol is the first choice treatment for extremely high blood pressure. If you give her lisinopril instead, it will increase her already high potassium levels, causing her to stop breathing. CPR would be necessary to save her life. And if you give her sodium nitroprusside, while it would lower her overall blood pressure, it could increase her brain blood pressure. So we realized these would all be bad, but we didn't end up giving her laboratol. We gave her lorazepam instead, just to calm her down. So we didn't actually lower her blood pressure. Maybe that's going to be a problem. This would lead to disaster. Increasing brain pressure would cause her brain aneurysm to burst. It can also burst if you haven't discovered the aneurysm by 6 p.m. So we were on a rush there. An angiogram brain CT scan can identify the aneurysm before it bursts. If the aneurysm has already burst, you'd still have to run an angiogram to figure out where you need to operate. Brain surgery will hopefully help Senator Perez survive the night, but saving the center involves more than just stopping the blood flow through the aneurysm. Too much stress, and the senator practically lives on stress, could aggravate the aneurysm. Her survival depends on how well you help her manage her anxiety and whether your actions make her more angry or help to calm her down. Sometimes bedside manner can make all the difference. Okay, so we did pretty well with her and did it quickly. Let's take a look at our score. 40 points if she survived, 10 points if we verified she's not having a heart attack. I can't remember if we actually verified that, but I think by diagnosing it, we did. 10 points if you identify lisdexafemitine as the cause of her panic attack. I mean, I think we did discuss that the amphetamine is she's abusing it, and that would make her all freaked out. But I don't know that we positively identified that. 5 points if we calm her down. Melissa says we did not rule out heart attack. All right, so we're not going to give ourselves the 10 points for that. 5 points if you verify her kidneys are not a cause of symptoms. I don't think we did that. 10 points for lowering her blood pressure. We thought strongly about that, but we didn't do it. -5 if we gave her the wrong thing. 20 points if we get 20 points if we had an aneurysm, but 10 points if we figure out that the amphetamine is causing her panic attack. That seems awfully weird. But okay, we've got 40. I'm going to give ourselves 10 for this, but not for this. 40, 50, 55. I'm not going to give us these two. Not going to give us this plus 20. So that's 75 base. And then let's see. -15 if it ruptures. She might have brain damage. Yikes. 5 points if you recommend she should get help to deal with her stress. What did we say? Stop the amphetamine, take a vacation, and counseling. I guess we're going to give ourselves that 5 points. 5 points if she should get drug addiction counseling. Yes, we told her to stop her amphetamine. I'm going to give us points for that. -5 if you took longer than 30 seconds to respond to the nurse at brain surgery. I think I said pretty quickly, but that's debatable. But I'm going to give ourselves the 10 points. So I'm going to give us, that gives our total score for her is 85. I don't think we did the troponin. I don't think we did. Can we check? Yes, we can check. We never did the troponin. Once we cottoned on quickly that she had an aneurysm, that was the end of our... That was the end of our search. Maybe we should have looked at more, but... Okay, so we got a generous 85. Could have done better. I agree. When we read this, it said that this is for extreme high blood pressure. So we decided not to lower it. So I'm not sure. I don't love this part that it gives us 10 points if we lower her blood pressure. That seems like... Well, it's not really all that reasonable. Okay, so here we are now with the epilogue for the kid. If you have revealed a card with the time, but not a card with the this, read LTP. Okay, we did that. Treating someone who doesn't want to be treated is hard. Treating someone who's also without an identity is even harder, as not knowing your patient's past medical history makes it more difficult to diagnose and treat symptoms. Given the lack of information you have, your safest course is to assume the worst, because Narcan can wear off before the other drugs in his system. John Doe might have a dangerous rebound overdose. Someone needs to monitor him constantly to respond if this happens. A rebound overdose does occur. If a rebound overdose does occur while you're dealing with one of the many distractions typical of a hospital setting. Oh, it's just saying, and it does happen. As the rebound overdose occurs almost immediately, it must be over an hour since he received the dose of Narcan. He stops breathing during the rebound overdose. CPR must be administered before giving naloxone to counteract the overdose. So this is going to happen no matter what. During the rebound overdose, the John Doe tears open his head laceration, so that needs to be sutured. He also has a festering scab on his arm, as you can discover. Antibiotics are required to treat the infection and prevent him from going into sepsis. Running a standard drug panel would reveal the John Doe has taken either heroin or morphine. However, a synthetic opioid drug panel would show he also has fentanyl in his system, perhaps unintentionally. If it were mixed with the heroin or morphine, it's the fentanyl that's causing the rebound overdose. A Chem 7 lab would show high creatine and BUN levels, indicating a potential kidney injury. The nephrologist suggests dehydration is the likely cause of his kidney injury. If you give an IV, his creatine and BUN get better. That's important if you want to use gadolinium contrast dye for a spinal MRI. There are several probable sources of back pain. A spinal MRI would rule out a spinal epidural abscess, typical of drug users who use contaminated needles. However, if he's dehydrated, his eGFR will be less than 30 because of low creatine, triggering an adverse kidney reaction to the MRI gadolinium contrast dye and requiring dialysis. Checks chest x-ray, verifies he doesn't have a major bone fracture or kidney stone. A lumbar puncture rules out spinal or brain cancer as the cause of back pain. So what is the source? When you search for the cause, you can give the John Doe something to ease his pain. Unfortunately, given that he has overdosed on opioids, giving him an opioid-based medication like codeine, oxycodone, or Vicodin will trigger another rebound overdose and require another dose of Naxalone to counteract this. Even ibuprofen should be avoided as it might cause further trouble with his kidneys. Remember, we debated that a lot, and we ended up not giving it to him. The best pain medication is acetaminophen. Unfortunately, the John Doe survival depends upon how well you've cared for him. Too many mistakes, and even his young body will give out. Okay, the final discovery is John Doe's identity. Senator Perez is his mother. With this important piece of information, you can see there's a 50% chance he has polycystic kidney disease. Verifying this with a kidney ultrasound confirms the source of his back pain. If only you'd had his medical history to start with. And this pain is likely the reason he's been taking heroin or morphine. Okay. 40 points if he survived. 5 points if you immediately monitor him. That was our first real argument. The channel did not want me monitoring him, but we did get 5 points for it. 5 points if you administer CPR immediately after the rebound. Okay, so we got both of those. So this was going to happen no matter what. 5 points if you give him Naxalone immediately after. Right, so we got all of these points. 10 points if we suture his facial laceration. 10 points if you gave him antibiotics. Minus 5 points if you give him the bad antibiotics that are bad for kidneys. Unfair, you didn't know he had kidney condition? Tell that to John Doe when his kidneys fail. Minus 10 points if he goes into sepsis. All right, so we got perfect here. 40, 50, 55, 65, 75 here. And then over here, let's see. 10 points if you gave him IV. Minus 5 points if we had a gadolinium emergency, which we didn't. 10 points if we eased his pain. Minus 10 points if we gave him opioid. All right, we lost 10 points for that. Minus 5 points if we gave him ibuprofen. No. Plus 10 if we figured out he has polycystic kidney, and plus 5 if we recommend drug or pain management counseling. I mean, we told him to stop the opiates. Does that count? So 10, 20 minus 10 is back down to 10. Plus 20, maybe 25. Maybe we'll give it 22. 97 on him. So how could we have done better? I suppose after we had diagnosed her brain aneurysm, we should have lowered her blood pressure. I'm not sure I agree with that, but we should have double checked to make sure she didn't have what? It wanted us to treat her, verify that she didn't have a heart attack. I guess that's a valid loss of points. We should have checked that. I'm not sure what you would do if you found she did, but after the surgery, maybe we should have checked. And then for him, we could have done better if what? The only thing we could have done better here is not given him the opiate. I don't think I agree with this either, because we considered it. That's why we didn't give him opioid at first. And then we waited a good 3 hours, and we were told that the Narcan wears off after 3 hours. It feels like giving him a couple of pain pills shouldn't re-trigger an overdose. So I'm not sure I completely agree with that. But our combined score is 182. Pretty good. Pretty good. So yeah, it wasn't the Narcan that OD'd him, but a couple of oxycodone pills. I don't feel like that would have OD'd him. Okay, but good point. All right, now let's talk about it, and then we'll look at the cards we didn't see. So let me go up and make sure I've caught everyone's comments here. Okay, Debbie says, I'm not happy with this case. We identified possible kidney issues early on, and the game just wouldn't let us diagnose them. We even spoke to a specialist, and it didn't do anything. In fact, he gave us pretty bad advice that we didn't need. Misty says, I mean, it's not related to what the game is asking for, but it doesn't surprise me the kid's probably trying to self-medicate with morphine since he had kidney pain. His mom is a pill popper. Nelson says, well, I think there's a real problem on the kidney disease detection, as the game seems to want it to be detected at the end, and we knew since the beginning. Misty says, we should have had the ability to ultrasound the kidneys. Melissa says, you know the group really tried everything and worried after every decision on the boy when no real outcome was ever going to happen. Plus it's bugged. The Chem 7 test and final story reveal is hidden behind a stupid metagaming thing with the cards. I like the setup and the tension was good. It feels less satisfying than the others. Nelson says, I wouldn't say the case is bad. In retrospect, even all the discussion it generates shows how stressed we got. I really like this game. Misty says, it's a good case, some of the mechanics were wonky. We should discuss how to minimize the metagaming part because it's one of the main issues in this game. Yes, I think you have a point. Debbie says, Melissa, yeah, I feel misled, honestly. We weren't allowed to actually solve the case ourselves. It's not a bad case overall, but they railroad you too much. I agree, the specific case was a bit railroaded. I understand why they did do that. Melissa says, it's frustrating. Every other case, there was an outcome to get to. They purposely made this one so you couldn't find that outcome. That's why we tried every single thing. I can't remember any mystery game that had such an emotional impact as this one. Only if we had just said, okay, fine, be in pain, and ended the case were we going to get the answer. Which is weird because that's exactly the wrong thing to do in most of the cases. Yeah, so it's worried about the status card being in extreme pain, but then if we knew there were no others left, it makes no sense from a realism perspective to just leave the guy in pain. I hope something will turn up. I feel like this whole case was set up early on to give away that they were related, but then didn't give you the satisfaction of actually proving it. I think we should disregard all tests after speaking to the kidney specialist. Honestly, in real life, that should have got us to the solution. She wasn't shown as having extremely high blood pressure, so what is with this case? I agree with you. Like, her blood pressure wasn't that high, so I don't know that she needed to be given the drug for extreme thing. Okay, and then there was a question about whether we did the troponin test. All right, so there's good and bad here. First of all, this is an amazing game. As Nelson said, the amount of tension and the amount of worrying we do playing this series is more than any of our other mystery cases. There is something about worrying about people dying while you're responsible for curing them, and the tight time limits that creates a real sense of investment, emotional involvement, and worrying and tension. And I think that carries through all these cases and was very much the case here. The structure of solving two cases at once was brilliant. I mean, that created real tough decisions about who do we prioritize, when do we switch from one to the other. Really great idea. I love it. You could almost make the case that you could have all the cases like this and maybe throw the person all the cases at once. That would probably be overload, but that worked really well. Now, there were a couple of things, though, that didn't work as well in this case that work in almost every other case that we've played. So let's talk about them. The big one has already been talked about a lot by the chat here. This fact that this kid, it really seemed like there was a little bit of a misfire. It feels like maybe this case wasn't polished as much as the others. It felt like there may have been a small bug here and there with the nephrologist, but also this whole thing where the game really seemed to think that we weren't going to figure out that they were related till the end, but it was sort of an obvious possibility, an obvious strong possibility to us right from the start. And then the fact that we thought that the kid probably had some kidney disease, and every single approach that we tried to use to get at that, the game sort of seemed like it had nothing for us. We did the kidney test and it had this very ambiguous answer about the creatine level. And then we thought, okay, surely we'll go to the nephrologist. We had this little bug about him suggesting a Chem7, but when we worked that out, looks like probably they meant to give us a card, but they didn't. Even then, the nephrologist specialist was of no help. He's like, he's probably just dehydrated. She said, he's probably just dehydrated, which we figured out for other reasons. So it was an odd miss, an unusual miss in this game that it didn't let us solve that. And then it had this question at the end, like, your intuition tells you you're missing something, write down what it is. I mean, that was a very odd choice. And then there were a couple times when the rules were not clear, like if you have 4 of these symbols, but 4 different symbols for the same, doesn't matter. So there were a bunch of little mechanical, feels like things that needed to just be improved. And then this was sort of a big one, though, that we figured out he had a kidney problem, but we weren't allowed to investigate it on our own. Another place where this game was particularly unsatisfying compared to the other cases were the interview questions. They didn't seem very useful when we looked at them, and then when we asked them, they were even less useful. That was a very weird thing. It's almost like this game is training us with counter messages. Like the last case seemed to have trained us that every question gave some useful information. And this one was the opposite. Not a single question gave us useful information. And I think you could also say that this case is marked as expert level difficulty. But in reality, it was easier than some of the other cases in understanding the causes. It was harder. It was more difficult in the sense of being frustrating. Like it was more difficult because we couldn't get them to tell us useful information and because we couldn't get to run useful tests. So I think in terms of difficulty solving the mystery, it was not the hardest. But in terms of difficulty of actually dealing with these patients, it was the most difficult. Which is not a... I mean, it's got to be one of the challenges of the job. So in that sense, it's fair, but it really felt a little bit like it was difficult for reasons not mystery related. Still a great experience and a super deluxe, not deluxe, a super long combined case was pretty cool. I do feel like they didn't polish this case as much as they have the others. Okay, let's take a look at the cards we haven't seen and see if we can spot anything interesting. So the senator, let's see what we've got here. I do like, actually, before we do this, we should say one of the other things that worked well here that was cool is a couple of the unusual things where it said if you have more of this, then read this. Like there were definitely places where we could get these people happier or more irritated. And the senator looked like if you weren't careful, you could trigger her anxiety and trigger this aneurysm. So I think there were a bunch of things that could have gone wrong with her that would have been interesting that we did well to avoid. So we asked her, I guess we're asking her about herself. That calms her down a little bit. She says, I'm worried I'm having a heart attack. I'm sweating. I have chills. You know, a fucking heart attack. And then we asked her to take, if she'd take her blood pressure at home. She says, I haven't used it. And then we asked her about her polycystic kidney. She says, it's under control. I have a pill for it. What about your heart? It's racing. I can't get it to slow down. Is your job stressful? Oh, I guess if you ask her if her job is stressful, that makes her happy. She calms down a little bit. Oh, here she gets angry. What do we... Oh, if we say, you're leaving me... I don't know what we do that made her angry. We told her about some process that she doesn't want to get done. Okay, here we go. This headache's gotten out of control. She's collapsed. Her brain aneurysm burst. But we were very careful to keep her not upset, and we figured out her problem very early on. Here we called a specialist, a psychiatrist, about drug use. She's not happy about that. Wow, code blue, we gave her the wrong thing. She stopped breathing. The family is called. This is if the kid's dead. She notices that the son is Joe. Do you know him? That's my brother. Oh boy, that's a bad outcome. She's dead, he's dead. She turns blue and she does CPR. Okay. This is, we recovered her with CPR. What the hell did you just do to me? She says. Okay. We tell John Doe to call his mother. I thought we read that. We must have read a different version of that. Okay. Your aneurysm ruptures. This is if we tell her we don't have time to explain it to her. We did take time, so she didn't freak out. And she says, you better not screw it up. I think she's angry. That's the difference. She agrees to the surgery, but she's angry. The psychiatrist consultation. He says, give her lorazepam. This is the kidney specialist who says you got cysts, but it's not the end of the world. Cardiologist says she didn't have a heart attack. Here is her Chem 7. Abnormal. She's got kidney disease, but it's not killing her. Okay, brain scan. That's doesn't look good. That's what you already found. Prep for surgery. If only you'd recognize them sooner. So this is if you figure out she got an aneurysm, but it's too late. Whoa, she died. But it's difficult to tell what went wrong. Maybe there's nothing you could do. Oh, and look, if you combine them up, that's the card you get where the son survives and she dies. That's pretty clever, that depending on her result, different card combinations. Why does she have amphetamine? You accuse me of illegal drug use. Then we give her the wrong thing here. She's in pain. This is the blood pressure lowering medicine. She feels a lot better. Okay, and so she could have gotten into a collapsed state. All right, now let's see what we've got here. You don't need my name. Every question we ask him is, he gives us useful. Call your mom. Nope, you can't call my parents. Okay, you step out of the room. So this is if you didn't monitor him. You go back and you find him passed out because you weren't monitoring him from the rebound. Okay. It's a good thing you're monitoring. That's what we read. I don't know why there's a different entry for it. Then she opens her phone and dials Joe. Down the hall, another phone rings. So this is when the two of them connect. I don't know how you got that to happen. Okay. He starts to choke. His lips turn purple. He's getting worse. Here's CPR, but something went wrong. This is the senator discovering it's her son that's died. Okay. MRI says my chest hurts. I can't breathe. Does he have claustrophobia from the MRI? Okay, so we should have gotten this card when we did the Chem 7 test. Either I looked up the wrong thing or they forgot to give us this card. Oh, this is Chem 7. This is Chem 7 if we haven't given him, if he's dehydrated. So this would be the creatine low enough that if you gave him the dye, it would trigger him. But he's clearly dehydrated. Okay. Combination dehydration. Here he is. Nothing works. He died. Oh, that was if he died. Yikes. Okay. He died alone, believing his family wouldn't want to see him. Terrible tragedy, one that happens all too often. Wow. Lots of ways for people to die in this case. So this one, he meets his mother, and his mother died. John Doe is unconscious. He's gone into shock. Cut on his arm that we didn't treat. He's in sepsis. Okay, so actually this makes me feel a little bit better about how we did, right? I mean, we did save them both and got a pretty good score and did pretty well. Just a little bit of grousing about the game, but actually, boy, how'd you like to have some experience where both patients die? That would be pretty rough. Well, an amazing game series, really, quite extraordinary. Nothing else like it. An amazing accomplishment. I would definitely recommend to new players playing New York City Emergency Room over this one. I do think this is a best played second, and I do think this last set of cases has a lot going for it, but could also use a little bit of improvement. But still a good experience, fun and stressful to play it. I'm glad we all managed to get along despite all of the high tension, high stress. You could see how you would get on each other's nerves in a medical setting. Imagine playing this with real time constraints, having to make decisions super quickly. Boy, that would be stressful. Okay. They made a big deal about not knowing in reality, we would have been able to do the actual test to find out. I think it would have made her angry if we didn't explain the surgery to her and just made her go, yeah. All right, well, I had a lot of fun. I'm sad to be done with this game. Hopefully we won't have to wait so long for the next box. Hopefully they'll be working on more boxes. I do think this is a game ripe for some fan-made cases. Maybe someone in the channel feels like creating a fan-made case. If so, we'll play it. If you were, let's spend actually a minute here before we sign off. If you were going to make any constructive criticism for this game, I mean, there's a ton about this that is really good. I think Nelson was saying there's a little bit of a potential to metagame this, meaning asking things like, why is acetaminophen get added? So one way you could solve it is if there were more items to choose from, more red herrings. I think that might be a good decision. There aren't that many other improvements to make. I'll tell you what I wouldn't mind. I'm not a huge fan of this format. I think this pamphlet double-sided thing, I don't love this. Sometimes I'm looking for something, I'm like trying to find it. This does help, but you can see sometimes it's flipped. You're like, what's concluded here? This is where. I think this would be better done in a kind of, maybe in a full-size 8.5 by 11 or oversized booklet, all in one booklet, maybe spiral bound with one page per thing. Like, don't mix up, like, you know, tests on one page and then you flip it and you've got tests part 2, whatever, and then specialists, like, not in multiple pamphlet form, just a book. I suppose there are some advantage of this. If you're playing multiplayer, like this, someone can look at this, someone can be looking at this. But other than that, I think it would be more useful if this was in a bound, spiral bound book to make it easier to flip through and bookmark and stuff. But almost everything else works pretty well. All right, any final thoughts from the chat before we sign off here? Debbie says, I like the idea of fan-made cases. You'd need a lot of medical knowledge. Yes, you would. Nelson says, a full, complete book with lots of info to minimize the metagaming. Yes. I guess he was taking something to self-medicate for kidney pain. I mean, that was another part that seemed a little weird here. Like, he says, I have to do it on my own. Like, there's lots of pains you would self-medicate for, but I'm not sure self-medicating for kidney pain would be one. But maybe it's just giving him back pain and he's not sure what it's from. So yeah, a little bit of a miss with this mother-son thing. It was too obvious and at the same time undiscoverable. Okay, well, thank you for joining me. A pleasure as always, a stressful pleasure, but a pleasure nonetheless. I hope it wasn't too unpleasant for those of you with medical background. This game has triggered some people with medical background. I do appreciate Melissa sticking with us and being willing to go along for the ride when I did disagree. You can see for someone without any medical experience, there's a lot of realism here, but there's also a lot of shortcuts taken, and you can see why that causes a little bit of trouble. The more you know about this stuff, the more some of this may rub you the wrong way, but makes for a good game. All right, I'll see you all next time. Oh, what are we doing tomorrow? I'm not sure. We may skip a session tomorrow since we played for 6.5 hours this afternoon. Maybe I'll have a stream tomorrow on short notice and do something short. We'll find out. You'll find out the same time I find out. I'll see you next time.